All right. Good morning. Well, thank you for saying good morning. Good morning. Thank you. Welcome to the Phoenix Bioscience Core Campus. We're so happy to have you here. My name is Oakley Rogers. I'm one of the Associate Deans for the College of Health and Human Services. So on behalf of NAU and CHHS, we're so excited to have you here at this campus, which is our second largest NAU campus. Just a quick logistical thing for those who are in the room. The restrooms are kind of directly right behind us over there. We still have some food and snacks over on the other side. So sorry, those on Zoom. Hope you have your good snacks and coffee that you can enjoy as well. So I'm excited to introduce John Garcia, who's a program coordinator, director, from the Arizona Biomedical Research Center. And we're so excited to have him and with the support of the ABRC, so that way we can offer these kind of trainings for the community. So here, John.
Thank you very much, Oakley. It's a pleasure to be here with you this morning and with those of you who are in the ether. And this is an exciting time for us. And, I think it's, a great way to spend your Saturday. So as Oakley introduced me, I'm John Garcia. I'm the program director for the Arizona Biomedical Research Center. And that is an office of the Arizona Department of Health Services. It was formed back in 1984 and for the express purpose of conducting research in different therapies for the diseases related to smoking. And we are funded to this day out of tobacco tax money. So if you smoke, and I hope you don't, you help fund us. But if you don't smoke, you need to help fund us. No, I'm just kidding. And then we also have a second branch of funding coming from lottery revenue. So we have three principal programs. We have research grants that we give out to investigators, two levels of investigators, entry-level investigators that have 10 years or less experience postdoctorate, and they receive grants up to $250,000 for 3 years. And then we have grants for seasoned investigators, which could actually be from one to wherever they are in their continuum as far as their postdoctoral work. And they receive up to $750,000 a year for 3 years. And so it doesn't sound like a lot, but I think that in the research world, it's good because it can get you started and get you prepared and give you the experience that you need in order to get into the bigger money for research, the NIH grants, CDC grants, et cetera. And so we're happy to fill that void. We've also recently started working on pilot programs with community colleges to fund research at that level, because we realize that there's a gap. We look at the biosciences roadmap and we say, well, we want to feed the future needs of scientists in industry and government and the private sector. And in order to do that, you actually start back in the high school realm with the STEM programs that are going on and have been going on for, oh gosh, over 30 years. And so great, we get the interest going there. And then my program usually starts off postdoctorate. So there's this big gap. of undergraduate and graduate level research. How do we keep people interested? So what we decided to do was start with the undergraduate programs, provide some money for research, and then go from there, so that we have the continuum of interest, so that we don't have bright young minds wandering from the path of science and research, and go on off to things like, public policy. Oh, that's kind of what I did. Anyways, so that's one of our mainstays. So we're just closing out the application process for one cohort. We had over 100 applicants. We'll probably end up with about 30 grants that are awarded out of the 100 applicants. And then in the next month or two, we'll open up another cohort and hope to get some more applications. And we get people wanting to do research in all variety of areas of biomedicine. You know, cancer, ALS, diabetes, different, even the biomechanical areas for to help with skeletal issues, muscular issues, things like that. Things like that. Not enough coffee. So we cover the whole gamut. Then our next part is funding programs like this, research education. And so we provide funding to the 3 universities and both campuses of the University of Arizona, Phoenix, and Tucson, and to put on quality research programs. And so we are working very hard to do that. So we love doing this, and that's one of the programs. The first one comes out of the tobacco tax. Second one comes out of the lottery funds. And then third, we have this program that it's, to me, one of our crowning, the jewels in the crown, so to speak. And that's the public cord blood program, the Arizona Public Cord Blood Program. And in that program, we fund 5 hospitals in Arizona to collect, or at least to work with mothers, expecting mothers, to collect their donated umbilical cord blood, so that the stem cells can be used to treat over 80 diseases. And the number grows, every day. So we've, over the years, since about 2011, we've collected, I don't know, easily 10,000 cord blood units. And they are stored in a cord blood bank. Part of them are stored in the University of Colorado, Clemenune cord blood bank. And then we recently transferred our contract over to MD Anderson in Houston, Texas, and they store our cord blood. And then that's, just like bone marrow, it's put on the international directory, so that you look for a match, get a match, goes to the transplant doctors. The transplant doctors are able to hopefully save a life. Now, I'm going to have shameless plugs here. April 5th, we have our annual research conference. It's called the ABRC Flynn and VRP, Valley Research Partnership. And so we have a conference. We have probably 20 some researchers, some of the best of our programs. We ask them to come and talk. And also we have a couple of high-level keynote speakers. And so that's going to be on the 5th of April, right next door. sponsored by the University of Arizona. And I encourage all of you to, think about attending. It's hybrid, so you can come virtually or you can come in person and attend. If you go to our website at azdhs.gov/biomedical, look for events, and you'll have a whole calendar of events, including this one, that are on there, and it gives you all the details for registration. And then we have on April 18th is our annual cord blood conference, and here we have all the high level clinicians and transplant doctors and survivors come and tell us their stories and learn what's new in the cord blood area. So that is going to be held at ASU's main campus at the Memorial Union, and that's on the 18th, and it's an all-day affair. And you can also get the registration link through our website. Other than that, I just want to say have a great day. This is a topic that we can't say enough about. And I know that, I've probably been close to burnout myself in my career, and you don't recognize it. And we need to be able to recognize it, and we need to be able to do some self-care, and we need to be able to help others. I got certified a couple of years ago as a mental health first aid practitioner. So, I really, it opened my eyes as to, how we listen to our friends and our coworkers, and we don't often recognize the signs of burnout that could lead to something worse. And we don't want that to happen. And it's just a stepping stone away. So enjoy, open your minds, absorb all this great knowledge, have a good time, and thank you very much for being here. And now I will turn this over to our principal speaker this morning.
Before we get started, we are very fortunate to be able to offer CME as well as CEUs for our event. And I'd like to thank Northern Arizona Healthcare for CME and Summit Health in Show Low for our CEU applications. I do have to read, because of CME requirements, just a general disclosure statement before we get started. All relevant financial relationships listed by any of the planners or providers have been mitigated. None have any relationship or any, can't read the, no other individuals in control of content for this educational activity have relevant financial relationships to disclose with eligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. This activity has been planned and implemented in accordance with the accreditation requirements and policies of the Arizona Medical Association through the joint providership of Northern Arizona Healthcare and Northern Arizona University. Northern Arizona Healthcare is accredited by the Arizona Medical Association to provide continuing medical education for physicians. Northern Arizona Healthcare designates this live activity for a maximum of 4 AMA Category 1 credits. Physicians should only claim credit commensurate to extent of participation. At the end of the day's activity, you'll be asked to do a post-evaluation. In that post-evaluation, you can click whether you would like CME or CEU, provide your information. We will email you your certificate of completion. So any questions? But there is a pre-test. Can you put that QR as a requirement of CME? We need to do a pre-test, post-test. It just takes a couple of, less than a minute to do, but if we'll go ahead and put up a QR code. So those of you here in the room, if you don't mind, just take a moment to scan that and do the pre-survey. And then at the end, I'll remind you again about the post-survey and to check for CME or CEU. Thank you so much, sir, for the Ohio State University. And I've had the great opportunity of working with her when she was our dean at the College of Nursing there at the Ohio State University College of Nursing. She has a huge list of accomplishments, but I just know her as just an amazing mentor and friend. And she has really changed how we look at wellness with our students as a faculty. We have, since the pandemic, we have integrated wellness across our courses, across opportunities with students. And I know from student feedback over the years, it has made a huge difference for their ability to be able to get through a semester, especially doctoral education. It's difficult. I mean, we've all been there, and it's very stressful. But I had one student at the end of a semester email me and say, because of the activities that we did, and because I took the time to ask people how they were doing, he went on his own and got counseling and support. And I didn't know he had been suicidal during the course, but he had just mentioned a few things, and we met a couple times, and I just said, here's some resources. If you need help, I'm here to listen. But it makes a difference. And I think the topics that we're going to hear today, you're going to hear some amazing information. And I'm going to turn it over to Bern because she can kind of guide us on this journey for today.
Good morning. How many of you are excited to get just a little healthier today? Great. Even if you're not excited, can you please act excited for me? But I am excited really to be here. This is the topic that is so near and dear to my heart. I live it every day of every year. But I'm going to tell you my story, how I left my old stomping grounds at Arizona State to become a Buckeye at the Ohio State University. I just want to disclose my conflicts. And now for you to hear how I got to Ohio State. I moved to Phoenix in 2004. Michael Crow heavily recruited me to be dean of the ASU's College of Nursing. But before I tell you that whole story, I'm going to tell you how I grew up. So I grew up in that small little coal mining town in southwestern Pennsylvania, right on the West Virginia border. It was really part of the Appalachia. My dad was a coal miner. We lived in half of a little company house. It was probably 900 square feet. We struggled financially, but I was born with rose-colored glasses on, and I still can make lemonade out of lemons today. But my whole world shattered when I was 15, home alone with my mom when she sneezed, stroked out, and died right in front of me. Well, you can imagine how traumatic that would have been. I suffered from terrible post-traumatic stress disorder, depression, and anxiety. And after about 4 months, I was taken to my family physician by a cousin. And she said to that doc, please do something to help her. She's having nightmares. She hasn't slept for months. She's not functioning well in school. And that provider did what so many still do, first line today. What do you think that was? Yeah, got out the prescription pad, wrote a script for Valium, and said, give Bern one of these every night. She'll sleep and be just fine. And I remember taking a Valium that night, and I slept for the first time in months. But I woke up the next morning and I said, I hate the way I feel. I had this groggy hangover. And I said, I just got to gut it up and cope with my situation. But in the next 4 years, not only did I lose my mom suddenly, I lost a cousin who was like a brother to me following a motor vehicle accident. The year after that, I lost the only grandparent I ever knew and loved. And when I was 19, my dad had a massive heart attack. That's a lot for a teenager. But you know the story. What doesn't break us only makes us stronger. And as a result of what I experienced in that coal mining little town as an adolescent, I became passionate to become a nurse, then a pediatric nurse practitioner, a psychiatric nurse practitioner, and go on and get my PhD so I could develop my evidence-based COPE, cognitive behavior therapy-based programs that are now being used in all 50 states with reimbursement and integrated into K-12 schools and universities. But here's the saddest part of my mom's story. She had a history of headaches for over a year. And my dad kept saying, would you please go to the doctors, figure out what's wrong? She saw our family physician 1 week before she died. Her diagnosis, high blood pressure. Given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. Now think about this. 60% of people in Arizona and all across the country have a chronic condition. Yet 80% of chronic disease is totally preventable with just a few healthy lifestyle behaviors that I'll be talking about later. Sadly, most people don't change behavior until crisis happens or their emotions are raised. As healthcare practitioners, we feel really good when we educate people. We give them all these facts. Like, do you know 1 out of 2 people with high blood pressure still don't have it under control? So we feel good. And I'm not saying we need to stop educating our patients, but unless we combine evidence with emotional story, people aren't likely to change. So evidence plus emotion usually leads to some kind of change. So how'd I get to Buckeye Nation? I moved our college to the downtown campus. In fact, I had the blessing of helping to design that copper building for the College of Nursing. It was a wonderful experience. I was at ASU for 6 years. I don't want to offend anybody here, but I thought I moved to the moon when I moved to Arizona from Rochester, New York. I really didn't like living here full time. I love the sun, especially in the winter months, but I didn't like the brown, and I missed green and trees. My dogs missed green grass and trees. But I had just said to my husband, you know what? I have finally adapted to Arizona. So you're going to be really happy because John loves Arizona. So I said, we're here. We're going to finish out our life's journey in Arizona. I said that. And 1 month later, my assistant walks in my office, which was right down here, and said, Bern, there's a vice president on the phone for you from Buckeye Nation. What's Buckeye Nation? She wants to talk to you. Don't you go anywhere, she said to me. So I answered that call that day. And Carol Whitaker was chair of the search committee. And Ohio State was looking for a new dean of nursing. And Carol said, we've seen how you've exploded the College of Nursing at Arizona State. Won't you come to Ohio State and do the same thing? I said, you know, Carol, I'm so humble. You guys have thought of me at Ohio State, but I have no intention of leaving sunny Arizona and moving to Columbus, cloudy Ohio. But I had been studying corporate wellness for about 3 years, and I was flummoxed at the fact big corporations got employee well-being, all the benefits of keeping your employees healthy, and they were hiring chief wellness officers. But when I went to look for what universities had a CWO, zero, none. That was my next dream, to be CWO, the first one in the country at a big public university. So I just pitched that dream. I said, I'm not interested in making a lateral move, but if Ohio State was willing to consider a joint leadership position for me, not only as Dean of Nursing, but as their first chief wellness officer, and that would be the first in the country at a university, I might talk to you guys. And I am not kidding you. The next day, Gordon Gee, our former president, called me. And this is how Gordon talks. We're still friends today. He said, Bert Melnick, this is E. Gordon Gee, the president of the Ohio State University. What the Sam Hill is a chief wellness officer. And what would you do for Buckeye Nation if I appointed you in this role and give you the resources you need to carry it out? He said, at least come and talk to me. So they flew me out. One thing led to another. And in 2011, I left sunny Arizona for Columbus, Ohio. So I have been in this position for almost 13 years now. And after a great 12-year run as also dean of our college, I said to our current president, I've been juggling 2 full-time jobs for the last 12 years. We got the college, all these wonderful rankings. I had the blessing of building a new building for us in Columbus, too. And I said, I got to get some quality of life back for me. And she was like, Bern, don't leave us. What do you want to do? I said, I want to move into my vice president CWO role more full time. So that's what I did this July. And I am happy to say I have a better quality of life because I'm not juggling 2 big full-time jobs. But since my appointment, we now have 90 CWOs across the country. So we started a movement in wellness at the Ohio State University. And I predict in the next 10 years, it'll be at least double or triple the number we have now as more universities, more academic medical centers realize the return on investment and value of investment you get with the CWO and vibrant wellness programming. So I tell my story, a lot more of my story in this book of mine, but it's been an awesome journey. Well, at Ohio State, we obviously are very steeped in well-being for our faculty, staff, and our students. I did last year a big campaign, a vitamin G campaign at Ohio State. Vitamin G for gratitude. I just want to thank all of you for what you do on a daily basis. But gratitude is one of the simplest evidence-based practices that if we put it into action every single day, our stress will decrease and our mood will improve. So I always say, take and give a dose of vitamin G every single day. Well, all of you know we had the triple aim. Then we had the next aim, the quadruple aim. Now we have the quintuple aim. This is the secret, though, to reaching the quintuple aim in healthcare. Now, I have been pounding the drum for evidence-based practice since the 90s. The Institute of Medicine, now the National Academy of Medicine, said years and years ago, they set a goal. By 2020, 90% of healthcare decisions need to be evidence-based. Well, I will tell you, I've been so blessed to have Cindy Beckett as part of my wonderful team in Columbus. And I will tell you, we are so far from reaching that goal. Our team still does a lot of research in this area. Just a few years ago, we did a national study on what was the competency, EBP competency of over 2,000 nurses across the United States in evidence-based practice. Guess what? All of those nurses said, we're not meeting any of these competencies. It is startling. It is frightening where we're at in terms of evidence-based practice until it is in the DNA of every practicing clinician, physician, nurse, pharmacist, occupational therapist, whoever in healthcare. We will continue to have poor outcomes. Think about this. The United States spends more money on healthcare than any Western world country. Yet we rank in the bottom of healthcare outcomes. Between 250,000 to 400,000 people lose their lives every year in the United States from preventable medical errors, many of them committed by well-meaning clinicians that are just plumb burnt out, totally burnt out, or they're not following the best evidence-based practices. We're the worst country to deliver a baby in. 700 women die from childbirth in the United States every single year. Many of those women die because of providers not following best evidence for complications like hemorrhage and high blood pressure. It sounds awful, but if you want to up your odds of dying today, get yourself admitted to the hospital. It is the third leading cause of death, preventable medical errors behind cardiovascular disease and cancer. How outrageous is that? But again, unless we get EBP in the DNA of every practicing clinician, and we get every clinician well, and we combine that with advancing health equity, if we don't do these three things, we're still going to be at the bottom of Western world countries. Paradigm shifts take decades to happen. I mean, I've been publishing books on evidence-based practice for the last 2 decades, and we're still where we're at. I run around the country and globe doing keynotes on EBP, conducting workshops. I'll be 100 if I'm blessed to live that long, and there's still going to be a need for me to run around the world doing workshops on evidence-based practice and clinician well-being. As far as the burnout rate in clinicians, that includes physicians, nurses, pharmacists, optometrists. My team has done so many national studies, interprofessional studies, so I can quote you verse by verse on what our burnout rates are. And I'm going to show you some of this data today. But we're experiencing the terrible twos. And I'm not just talking about toddlerhood. I'm talking about too much stress, too much work, too many tasks, bureaucratic tasks. We got to get rid of stupid stuff. We really do. To give our clinicians more time to care for people, which is why they came into the health professions. And then too little time, the misperception that we have too little time for good self-care. We know, we have done so much research on burnout in the health professions. We know all of the causes. A lot of the causes are system problems that need to be fixed. At Ohio State, my charge as CWO is to improve population health and well-being of our faculty, our staff, and our students. Get everybody healthier. And I'm going to show you what we've done on our journey that has had a really positive impact. So part of my job is to make sure our faculty, staff, and students have access to the best evidence-based wellness programs that we know work, like cognitive behavior skills building, mindfulness, and so on. But we could have the best programming in the world, but if there are system issues that need fixed, like people being too overworked, understaffed, there's a big problem if you have to do 11 clicks in the electronic medical record if you want to give a flu shot. That's a problem. So part of my job as CWO is to bring system issues to top administration, saying these issues are causing burnout in these units. We can offer the best wellness programs, but unless we fix the system issues, we're not going to move the needle by that much. So in 2017, the National Academy of Medicine said, there is an epidemic, a public health epidemic of clinician burnout, depression, and suicide. And we got to act fast, because if we don't act fast, more people are going to lose their lives. More preventable medical errors are going to happen. I was so blessed to be appointed to be one of 60 leaders throughout the country that was appointed on this action collaborative for clinician well-being. I am still actively working on this task force. And if you haven't seen what we've put together in this website, I would encourage you to check it out. This website is awesome. It has evidence-based tools, resources, recommendations for how to improve clinician and learner well-being. Last year, I was in DC with this Action Collaborative to launch our national plan for health workforce well-being. How many of you were aware of this plan, this national plan? Was anybody aware of that? Okay, I really encourage you, download this plan. Better yet, because these are all the priority areas. Take it back to your leaders and say, which of these are priority areas are we going to tackle in our college, in our hospital, in our organization? So we are actively spreading the word on this national plan. And we want every organization in this country to be not only aware of the plan, but actively involved in the plan, saying, we're going to do X, Y, and Z in our institution. Well, in March of 2020, the pandemic hit us in the United States. Oh my gosh, rates of burnout, rates of clinician suicide really started to escalate. People attempted to cope with COVID with unhealthy lifestyle behaviors. So we saw emotional eating go up all throughout the country. We saw alcohol use skyrocket. In fact, in professional working women, it is epidemic right now. About 25 to 30% of working professional women have issues with alcohol misuse right now. And physical activity went down. So, of the studies that looked at weight gain just during the pandemic, what do you all think the average weight gain was of people who did gain weight during the pandemic? What's your guess? You're really close, 29 pounds. So, what that's going to mean 3, 4, 5 years downstream, we're going to have more chronic disease. So, more than 60% of Americans are going to have chronic disease. So, that's definitely going to go up. These are the beautiful faces of nurses and a physician that killed themselves during the pandemic. I don't know if you remember reading Dr. Lorna Breen. She was a physician in New York City. She was totally overwhelmed by all the COVID-19 patients. She was so stressed out and depressed, she admitted herself to a psychiatric inpatient unit. She was there for 10 days. She got out. She was so fearful the medical licensing board was going to take her license away that she killed herself. So her brother-in-law and sister, Corey Feist, who I'm good friends with now and a collaborator, started the Dr. Lorna Breen Foundation. Corey, I just met with him. I was at the University of Virginia to do some presentations there. Corey and I are still doing work together. We have so much work to get done. But he was so successful in getting this Lorna Breen Healthcare Provider Protection Act passed. That act gave millions and millions of dollars to grant applicants all throughout the United States to improve clinician well-being. Well, we have a mental health pandemic going on. And you know what's sad to me? Healthcare providers, they are the worst in terms of stigma and not facing their true story and saying, you know what? I'm really struggling with depression or anxiety. It's interfering with my ability to make judgments. It's interfering with my ability to function. I need help. We have got to say to our colleagues, it is a strength to recognize when we need help. It is not a weakness. You are not weak because you need help. Everybody needs help at some point in their life. And I will tell you, if you see a colleague struggling, I recommend stopping and just asking them 4 little words. Are you okay today? Are you okay today? Because just that question opens a window of opportunity for somebody to say to you, no, I'm really not okay today. And for you to say, you know what? Please know the 988 suicide and crisis prevention hotline. I was jumping up and down when our government created 988 to replace 1-800-273-TALK, because everybody can remember 988. If they're in distress, if they're thinking about killing themselves, they can call that number day or night and be confidentially connected to a mental health professional. So, this paper that we just published, pretty hot off the press, a year before we published this, in JAMA, there was a similar study on physicians and what states were still asking inappropriate mental health questions on their licensing board applications. So I saw that study and I said to my research team, we got to find out, has this ever been done in nursing? We searched, could find nothing on this. And I said, we've got to do a similar study. We got to find out how many states are still asking inappropriate, intrusive mental health questions that are a driver of suicide because people are afraid to admit they had a mental health disorder 4 years ago or 5 years ago. So we got to find out how many states are still asking those questions. How long do you think it took our team to get just the licensure applications from all 50 states? You're close. It took us about 9 months because they didn't just say, okay, Burton, you're doing this study. Here you go. Here's our applications for you to look at. My PhD student had to start applications, pay for them in certain states because we couldn't get them. I was on the horn with the National Council for State Boards of Nursing saying, help me. This is ridiculous that state boards aren't transparent about their applications. So Corey Feist from the Bream Foundation collaborated with our team on this study. And look at this, only 13 states ask appropriate questions. 37 states do not. But let me tell you what Corey and I did. As soon as this was getting published, we did a national webinar. We notified these state boards that were not compliant. And since we've done this, 5 states already have changed their questions and a lot more are in process. That's national impact. That's the kind of impact we want to be making when we see problems like this across the country. So where are we at? All of my national studies that I've published in the last 5-6 years, including the most recent, show burnout rates among the various disciplines of 50 to 70%. Now, I want us all to ask ourselves, do we want to see a burnt out provider? Do we want, or our family members, to be cared for by somebody who's totally burnt out? We absolutely do not want that. But this is the epidemic. Burnout is a public health epidemic right now. I've shown over and over again in our national studies, if somebody's burnout, they're also very likely to be depressed or clinically anxious. So there's very strong relationships there. Now, in my studies, there are 2 very key constructs that lessen burnout, depression, and anxiety. One of them is mattering. And not a lot of people study that construct. People who believe they matter to their organization, burnout rates much lower, depression, anxiety much lower. But the other construct that affects those variables is perceived culture of well-being. So again, if people feel their organization supports their well-being, they have so much better mental health outcomes, so much less burnout. But the other thing my national studies have shown, the majority of interdisciplinary clinicians do not meet evidence-based recommendations for healthy lifestyle behaviors. We don't walk the talk. We're telling our patients, get 150 minutes of physical activity in a week, eat at least 5 fruits and veggies, don't smoke. And then we're not walking that talk. And if we don't walk the talk, whether in our healthcare setting or with our students, what's the chance they're going to do the same? Not high. So that is key. So Cindy, Beckett, and our team, we did a study. We looked at chief nurses. We looked at DNP, PhD faculty. I'll show you that data too. But our team also looked at chief nurses and nurse managers across the United States. These were the outcomes. The burnout rate, nurse managers, 54%. In chief nurses, 46%. 30% of nurse managers hit the cutoff on a valid and reliable instrument, the GAD-2, for anxiety. Chief nurses had less, and about 15% of the nurse managers hit the cutoff for clinical depression, 11% in the chief nurses. But again, in this study, burnout, if people were burnt out, mattering wellness culture made huge differences. And look at this other finding. Nurse managers without staff shortages were 6 times more likely to not have burnout. So again, staffing shortages are a big system issue. And so many of our hospitals throughout the United States are really struggling with staff shortages. As mattering increased, burnout, depression, and anxiety decreased. So again, if you all are supervisors in this room today or leaders, making sure your people know they matter. Like I so appreciate a lot of vitamin G to your people, a lot of telling them, you know what, you're key to this organization. When I was dean, I always said to everybody, every member of our college matters, all the way from top leaders to our janitorial staff. Everybody matters. But helping people to know that on a regular basis really works. So this is a national study that I did in collaboration with the Association of Hospital Pharmacists. And we presented this data nationally last year. Look at the burnout rate in our pharmacists across the United States, 64%, and only 17% said, I've got a good quality of life. 17%. This is really sad. But again, key finding, pharmacists whose workplaces very much who supported their well-being were 3 times more likely to have no depression, anxiety, and stress, 10 times more likely to not have burnout, and 15 more times likely to have a better quality of life. Again, mattering matters. Burnout, as in my studies with nurses and other health professions, the more burnout you have, the more preventable medical errors that are made. And that was true with this national pharmacy study as well. So here's another study we did in the Big Ten. So we surveyed Big Ten health sciences faculty, so medicine, nursing, vet med, pharmacy. And here's what we found. Very high rate of anxiety. 45% met the cutoff. Stress, burnout, about 55% existed in faculty, staff, and students, but most weren't getting adequate sleep, that 7-hour magic number, meeting physical activity and healthy eating recommendations. So again, wellness culture mattered. It matters. Culture is so important. It eats strategy for breakfast, lunch, and dinner. But the problem is culture takes time to change. The average administrator is only in place now for 3 years. The likelihood of changing an entire culture in 3 years is not good. It really isn't. Most cultures take 5, 7, even 10 years to change. So again, we found over and over again, all of our studies, mattering matters, culture really matters. So then Cindy and our team, one of our postdoc DMP fellows, we surveyed doctorally prepared nursing faculty across the United States. What did we find? About a third were struggling with burnout, but PhD prepared faculty had substantially more depression than DNP prepared faculty. We, in the themes, the open-ended feedback, that's because most of the PhDs were on tenure track. What do we do to our tenure track faculty? We put them under tons of pressure, right? To get grant funding, to produce. And that's why we really felt we saw higher rates of depression with them. So during the pandemic, one of my fabulous faculty, Kate Golick, who's on a panel in the next session, she walked into my office and said, "Bern, I am so burnt out on parenting. I have 4 small children." I said, "Kate, what do you want to do about that?" She said, "I want to create a scale that measures parent burnout." I said, "Kate, I think there's already a couple valid and reliable scales that measure parent burnout." But I said, "Has anybody developed one on working parent burnout?" So we looked, didn't find any scale, and we said, that's what we're going to develop. So we did a study, we published the scale, And our senior director of marketing and communications called the Today Show, because this was a big issue during the pandemic. And he said to the Today Show, I have 2 researchers here who developed this working parent burnout skill. Would you be interested in covering it? They said, absolutely. They sent a camera crew to Ohio State and Kate's home to film. They filmed us for 6 hours, me and Kate and her kids. And we got a 6-minute segment on the Today Show. But it was fabulous because they put our scale up on the Today Show website. Tens of thousands of parents took it and downloaded our evidence-based guide to prevent burnout. So we were really excited about that. But during the pandemic, our students really suffered. About 1 in 4 students, young adults, thought about suicide. 1 in 4. As with healthcare providers, we know the causes of burnout in our students. And we have so many universities that all have student wellness centers that are isolated and kind of doing their own thing. And again, unless you build this into the whole culture, unless you integrate student wellness with faculty well-being, staff well-being, you're not going to get the needle to move well. We know about the consequences of burnout. Our country spends almost $5 billion a year on burnout because the turnover, poor patient outcomes. So again, this is a critical issue that needs addressed. The average cost of turnover for a staff RN once they're oriented is about $52,000. For an MD, their cost 2 to 3 times their annual salary. So here's what we need to do. We need to take our evidence to leaders at universities and academic health centers, and we need to say, look what we are spending on burnout, but look at the return on investment. At Ohio State, for every dollar we invest in wellness, we get back $2 to $3.65. It more than pays for itself. And that's really important. So students in our courses, in our curriculum, in our programs, if they're burned out, depressed, and anxious, they're not going to perform well. So it's this vicious cycle, faculty burnt out, students burnt out. 2/3 of students who are no longer in college aren't there because of mental health issues. So here's a wonderful systematic review that came out last year. And they looked at a bunch of different wellness types of interventions. The majority found a positive ROI, doing what they're doing. But here's a big problem we have. Everybody's measuring return on investment differently. So we can't do like a meta-analysis and really say, this absolutely works and this doesn't. So we got a long way to go in calculating ROI. Linda Aiken, who's well known for her work in this area, They published a study. They sampled over 21,000 physicians and nurses. And do you know what those individuals told them on their survey? Don't talk to us anymore about we need to be more resilient. We are resilient. What we want is our administrators to fix system issues. You got to do both. You got to equip people with evidence-based resiliency skills for sure, because not everybody has them, but you also got to fix system issues. This is the magic formula right here. Got to fix organizational system issues. You got to build resiliency in your people with interventions that are evidence-based. And you got to build and sustain a culture of wellness where people know they matter. Now, it might surprise you, but since 2000, we've quoted there's a 17-year time gap between the production of research and its implementation in the real world. 17 years. But in 2021, another study was done that said, wait a minute, guess what? We reduced that time gap by 2 years. So in 2 decades, we reduced the time gap by 2 years. So at that rate, it's only going to take 150 more years until we produce best evidence and it's scaled. It's translated immediately into practice. That's ridiculous. Our team, as part of the National Academy of Medicine initiative on clinician well-being, we did a systematic review. What works for both physicians and nurses? These 6 interventions work. So every healthcare system in the country should just make sure these exist in their organizations. Again, we got to do what's right based on best evidence, but change takes so long because we have way too many sacred cows that exist throughout our organizations. If you look at the whole body of literature, plus our national studies, these things work. These work. So, okay, let's everybody take these bullets and say, this is what we're going to do. We are diligent about measuring outcomes. You got to measure outcomes. We take an evidence-based QI approach at Ohio State. So annually, we measure these things. Then we see the data and say, these are the units that are really struggling. I got to get my wellness team in there, and we got to improve these things. So I'm going to finish by just rapidly walking through what we've done at Ohio State. The National Academy of Medicine a few years ago promoted and recognized my university as an exemplar for wellness because of what we have done and the outcomes, the positive outcomes we have shown. But we are big. We have over 66,000 students on 5 campuses, 40,000 faculty and staff, 7 hospitals, primary care clinics up the wazoo. We are a big, big place. When I got to Ohio State, our health plan was doing a good job for faculty and staff. We had a web wellness portal that was doing some good things. Student Life had a student wellness center. They were doing good things, but guess what? Everybody was working in silos. There was no aligned vision. There was no strategic plan for health and well-being. I had to create that. And the structure that we currently have for wellness. You can go to our website, my CWO website. Our strategic plan is right there. We are just finishing our third 5-year strategic plan now. That has to be approved all the way to the president's cabinet and our board of trustees. It's got to be integrated into everything we do. That's our 4 main goals. We have 4 new ones coming up in the next 5-year strategic plan. But again, you've got to know where you're going. And most universities don't have a strategic plan for wellness. And you got to have one. It's got to be aligned with the university's strategic plan. This is my wellness team at Ohio State. So it's comprised of all of these units. We sit together, leaders, faculty, student representative, facilities, communication. We sit together 1 day a month. We look at data. We look at best evidence coming out. We make sure we're implementing our strategic plan. And under this one university-wide Health and Wellness Council, we have 5 sub-councils that focus on specific targeted areas. This is the framework. We use the socio-ecological framework. We target evidence-based interventions to the individual, to the family and social network, to the culture, to the environment, to policy. And we rigorously measure outcomes. I developed an adaptation of my COPE CBT program for clinicians. We've tested that through randomized controlled trials. I just got a big grant last year from the American Foundation for Suicide Prevention to digitalize my COPE program. It's called Mind, Body, Strong. We're testing it now in a randomized clinical trial with nurses at high risk for suicide. We have 32 wonderful pet therapy dogs. So when I do rounds in our medical center or wherever across the university, I like to take a pet therapy dog with me. I will tell you, the stress melts off people when they have these therapy dogs at their disposal. But here's the trick: multi-component intervention strategy that targets the system, the top leaders, faculty, supervisors, managers, and individuals in the grassroots of the organization, all within a culture that makes healthy behaviors the norm or the default, and the diligent measurement of outcomes. We also know, this is our data, if we can get people to participate more in what we offer, they have much better outcomes. Engagement really matters. We track all of those outcomes. I do 42 presentations every spring based on our prior year's data to our deans, their cabinets, our vice presidents, their cabinets, and I show them de-identified data This is your faculty and staff data. They're doing great with nutrition and physical activity, but maybe they're not with stress, anxiety, and depression. So we focus on that strategically the next year in that unit. But I gave all of you, again, the evidence-based strategies, the lessons we have learned at Ohio State. And it really, this is a guide. If other institutions do what we did the way we did it, they're going to get good outcomes. I just really want to emphasize too, getting rid of stupid stuff. Academia in particular has so many bureaucratic processes that if we could eliminate some of those, oh my gosh, what we wouldn't do for our people. We have over 700 faculty and staff as Buckeye Wellness Innovators that work with me and my wellness team to create cultures of well-being in their units. So we have to have a paradigm shift. We'll always need great crisis and sick care. But unless we shift the paradigm more to wellness and prevention, we're not going to see great outcomes. And now I'm going to finish with some tips for all of us. We can't continue to pour from an empty cup. We have got to prioritize our own well-being, because if we don't, we're going to suffer from burnout. Now, I will tell you, during the pandemic, because I knew how stressed our people were going to be, I ramped up all of our wellness initiatives at Ohio State. And a year into the pandemic, I came home one day. My husband asked me just a nice little question, and I nearly bit John's head off. And that's not me. And Cindy knows that. I'm very calm. I'm very warm, those sort of things. But John said to me that day, you're burning out. What are you going to do about it? You got to face your own story. So I thought for a minute or two, and I said, John, let's take a bucket list trip. He said, where do you want to go? I said, I want to go to Tanzania and watch the wildebeest migrate. He said, during the COVID-19 pandemic, I said, yes, we got to do that because I'm going to shut off my computer for 10 days. My teams are capable of handling anything that comes out. I need a mental health break. So we went, these are photos we took over there. If you've never done anything like this, put it on your bucket list. It is fabulous. And cardiovascular disease is our #1 killer, technically. But if you put together all causes of death and disease in the United States, it's really what we do, our behaviors that are the #1 killer. And I am not kidding you when I say beware of your chair. If you sit even 3 hours a day, you increase your cardiac risk by 30%. If you sit 5 a day, that's comparable to smoking 1.25 packs of cigarettes on our bodies every day. That's research-based. Some of you look shocked when I shared that evidence with you. Then how come we didn't all stand up? It's culture. It's, again, we live in a sitting culture. So this is all you have to do. I'm not kidding you. If you want to reduce your rate of chronic disease by 80%, this is all you got to do. And people say to me, I don't have time. I say, sure you do. Don't do 60-minute meetings anymore. Only 45 to 50 minutes. You make them standing, you can get through them even more quicker, really. 5 fruits and veggies a day, don't smoke, and everybody gets happy when I talk about this one. If you don't drink alcohol now, don't start. If you do, limit it to 1 drink a day. Then everybody asks me, Bern, how big can that drink be? And I tell everybody, not the size of the alcoholic beverages they serve in Vegas. Add 7 hours of sleep on top of that, the regular practice of stress reduction, you're going to prevent 80% of chronic disease. But look at this. This is a real fitness facility in California. You have a choice. You can either walk the stairs or take the escalator to go work out at the gym. 2 psychologists wanted to know how many people during a common day for 7 days were going to take the stairs. What they found, only 2 people a day. So when you're faced with decisions, make the healthier one. If you did not set a New Year's resolution, today could be your January 1. Just take one of the behaviors that I showed. Get a little better at them. 30 to 66 days it takes to form a new habit. If you only exercise 15 minutes twice a week, say I'm going to do 20 minutes twice a week, because inch by inch, it's a cinch. Hard by yard, it's hard. Times are big excuse. We all have the same amount of time. And lastly, we got to put our dreams on the front burner again. I am so known across this country by asking people, if I could be your fairy god person today, what are you going to do in the next 5 to 10 years if you can't fail? I've asked that from every faculty I've interviewed the last 20 years of my career. How many people do you think can roll off a new dream? Not many. They look at me with a blank stare. And then they might say, I want promoted, or I want tenured. And I say, that's a good goal, but what's your dream? What impact do you want to make in the world? So I'm just going to finish by saying, I didn't have a mom to see me graduate from high school, college, go on and have my 3 beautiful daughters, my 3 character building dogs that I have. There are days I get up, I don't feel like jumping on my elliptical, taking my dogs for a 2-mile walk. On those days, I put those people's faces in front of me. Because you know what? They want me to be around a long time. So the grandkids get to know their Grammy. So when you don't feel like it, and if you don't do it for yourself, do it for the people who love you, who want you to be around a really long time. And join me. I have people all across the country doing my 155 eye-opener challenge. A minute of gratitude when you wake up. 5 minutes reading in a positive book or listening to a positive podcast, and 5 minutes of movement, some kind of movement physical activity. You're worth that. And if I couldn't motivate you enough, this little girl will.
Just do it! Don't let your dreams be dreams. Yesterday you said tomorrow. So just do it! Make your dreams come true. Just do it! Some people dreamers are obsessed. And you're going to wake up and we're going to work hard at it. Nothing is impossible. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it. If you're tired of starting over, stop giving up.
All of that, but I try to give you some things that you can really take away and maybe implement. Yes. Now, questions, comments? Yeah.
You mentioned a couple of times getting rid of the stupid stuff. Can you give a couple of examples
Yes.
of what that means?
Yeah. Meetings is for one. So about 4 years ago in our college, I told our faculty, we're not having any meetings until 11 a.m. on Mondays, right? So people aren't on email Sunday nights trying to get caught up, and no meetings at all on Fridays. And I had faculty call me and say, can we just do this one standing meeting? We've always done it on Fridays at 12. No, Barb, you cannot. You've got to pick another day. That was so wonderful for people. We meeting people to death, seriously. Charting. I just, AHRQ, they fund evidence-based practice centers. And I just did a key informant interview on documentation, the perils of documentation. We've got to decrease some of what we require, the way we require it, because it takes so much time away from patient care. So it's things like that. But to really look at the system, I put out a survey for our faculty. What stupid stuff do you think we do? Ask people that we can get rid of, really. There's another question. Yeah.
So I'm a hospital doc in New Mexico, and I work for a large private nonprofit health system. And so I appreciate all the work that you're doing. I'm interested in, since you described it, I think accurately, as like a partnership between clinicians focusing on their own wellness and the organization enabling them to do that, what can you and I do to kind of leverage influence and get more organizations to buy in? Because you work in a university that's a little bit of a self-contained system.
Yeah.
And obviously you guys have done really awesome things.
Yeah.
But for the millions of other healthcare workers nationwide, we don't have a chief wellness officer. We have some programming along the lines of things that you've described, but we deal with the same issues of understaffing and stupid stuff and documentation that everyone else deals with. So how do we speed up 15 to 17 years? Because I'll be at the end of my career by then. That will help me, Yeah.
See, here's what I'm seeing, because the National Academy of Medicine that we're working on right now, we've really targeted the C-suites of hospitals, universities, healthcare systems. And so we're really pushing the C-suite to recognize the ROI and VOI that comes with investing in this. But here's what a lot of places are doing. They're appointing a CWO in title, giving them 50% FTE to do their role, but no resources, no team. It's like checking off your task list. You have a CWO. Okay, we're good. No, That's not good enough. You got to invest in it. So providing them, we have published ROI data. And I think that's what you do. You take evidence to your upper administration and say, we got to invest in this more, because if we don't, these are the negative outcomes we're going to experience. Yeah.
Teresa,
Yeah.
care practices, smaller organizations to implement these concepts.
Yeah. Gets back to the same issues. Got to go to your upper administration of the practice. Got to show them ROI, VOI data from studies that have been done. They've got to invest in it. Unless people invest in it, they're going to continue to struggle. You know, Griselda, one of our wonderful DNP students, she'll be talking about what she implemented in an FQHC clinic. So there are things, low-hanging fruit things that can be done, like our Buckeye Wellness Innovator Program, 700 faculty and staff working with me and my wellness team. That's a high impact, low cost strategy that I think every organization, from a primary care clinic to a big academic health center, could implement.
Burnout.
Yeah.
Question, are the data showing differences between your smaller clinics, smaller, providers to the larger corporations, are either of those tending to be healthier, less?
You know, that's an excellent question, because most of the research has been done in the bigger places, right? There's been very little done in primary care, really. And so we need to do more research in those smaller entities to really be able to do some comparative. I will tell you, so I founded a new national organization. ASU is part of it. It's called the National Consortium for Building Healthy Academic Communities. BHAC is what we call it. But we have universities and academic health systems all across the United States who participate in that. We take a comprehensive approach. In October, I hope you'll come. So I do a biennial summit on clinician well-being that'll happen October 25th to the 27th in Columbus, Ohio. It's in collaboration with the National Academy of Medicine Action Collaborative. So again, we're doing all we can to get more evidence. We have a change maker program now going on at the National Academy of Medicine. We've got about 80 academic health centers and hospitals participating in that. This is still in its toddlerhood, is what I call it. But every university needs a CWO, every healthcare system, every primary care practice group needs somebody to spearhead these kind of efforts and to gather data. Yeah. Yeah.
Other one.
Yeah.
Earlier on, you said how there was a growth in the number of organizations, and I imagine that was more universities and, including colleges of medicine, that sort of thing, that have CWOs. Are we seeing an increase in our healthcare system? Are you seeing, like, how much of an increase are we seeing in those areas? And then kind of related is, you also showed that having shorter shifts for providers is a big thing. Of course, we've got the healthcare shortage. And I don't know if there are any success stories, or if you can comment to some of the challenges there. So we've got the realities of healthcare shortages with, now here's a way to help folks avoid burnout, because we're just adding more of the same people.
I hear you exactly what you're saying. But remember, a lot of people are leaving direct care because they're burnt out. So if you can plug the hole and help that burnout situation, it'll help the short staffing situation, right? The other thing, 12-hour shifts, like for our nurses, all my research that I published shows they aren't good. They aren't good. But the C-suite says, oh, burn, we can't eliminate 12-hour shifts because if we do that, our nurses will jump ship and they'll go to another hospital. They love 12-hour shifts. And I say, you know, if you show them the data with some emotion, they'll buy in to a different staffing pattern, and they do. Some hospitals have been more successful with that than others, but a lot of these nurses do their 312s, then they go work somewhere else to make more money. So they're in a chronic state of burnout. Medical errors are skyrocketing. This is a very complex issue. A lot of CWOs, like the network, I'm in a CHER network of 90 right now. Most are physicians. There's only 2 of us that are nurse practitioners, but a lot of those physicians are focused more on just the physician population. By narrowly focusing on a subpopulation, I'm not saying physicians don't need to have some tailored things specific to their discipline, just as nursing. But if you stay singularly focused, you don't hit the culture, the system side of things. And those are important. Yeah. Yeah. We're getting ready, hopefully in the next month, to sign a book contract to basically put a guide together for organizations, practices, healthcare systems.
Sources for trauma informed health workforce.
Yes. Would you email me? But first place I tell you to go is the National Academy of Medicine website. It's fabulous, really. It has so many wonderful resources. Yeah. Okay. With that, I don't know at what point you all want me to do some chair aerobics to get your blood flowing.
Break, so now is it?
You want me to do it now or after the
for
break?
15 minutes, so after the break or before?
And we can even do it after the next panel too. Okay. But I want to get everybody moving.
Why don't we do it after the break?
Okay, well, talk about full circle moment. I actually heard Burn as a keynote in 2022 fall at the ASAP conference. And so this is kind of what led to this opportunity. So talk about a big impact, you know, nationwide. It definitely is happening. But so my name is Oakley Rogers. I'm an occupational therapist by training, but I currently serve as one of the associate deans for the College of Health and Human Services with NAU. And I am actually located at the PBC campus, so where we are at now. And I'm just going to talk a little bit about how hearing Burn's conversation or talk a few years ago, what kind of inspired me to take action. So we developed an interactive workshop for students here on this campus. So I would like to acknowledge Zach Baker. We are very fortunate on this campus where we have somebody who is our learning coordinator, learning specialist. So his main role is to help our students be successful in graduate school. And so we collaborated on this initiative of workshop. And so just want to give a shout out to him. So as Burn mentioned, our college students are reporting significant issues, right? They're dealing with academic life and also being a student. So about 80% have reported having moderate to high levels of stress over the past year. Yeah, thanks. concerning, almost 50% have reported having that serious psychological distress. And that's a concern because what are they doing to either alleviate that? What are we doing to help them? What are we doing to contribute to that? And so that's concerning. And then almost a third of them have that positive suicidal screening. And so as Bern had talked about, that is some serious concerns. And so from the college level perspective, starting to think, what can we do to hopefully help them to either alleviate that, learn how to deal with that, think about strategies. And I loved that, Bern. I took that away from today. What can we do to get rid of the stupid stuff? I wrote that on my paper. What can I do to help get rid of the stupid stuff? So that's my next action. But so in particular, when we look at those healthcare students, I think what is really startling to me when I started to dive into the literature, where more than likely before our students become practitioners, they are going to experience burnout. And so how can we expect them to go into this healthcare profession and not be burned out if they're already experiencing that as students? So that's where I really started to think of, okay, what can we do to help these students? So obviously that stress related to the academic and clinical demands. A lot of our students come in, they've worked so hard in their undergraduate programs to get to where they're at. You all have probably experienced something similar, to get to where they're at, and now they've got higher demands on themselves to be successful. A lot of our programs, you have to earn certain GPAs, certain requirements. When you have those clinical demands of being a student and also going out in this professional workforce. Okay, so probably things that we may have experienced ourselves. What I found to be interesting is where the stress for a lot of these students, where it's reported higher, is as they're preparing to transition into those professional careers. So not only during the time when they're in that academic world, but then as they get ready to go into that professional real world that I've been studying and training so much for. Perfect. So a little bit about this where we're at right now at the PBC. So NAU has been on this campus for 10 years. As you can see, our primary university, the main campus is up in Flagstaff. So some of you live there. But at the PBC, we are a satellite campus. And as I mentioned earlier, we're the second largest campus for NAU, which is great because we have about 450 occupational therapy, athletic training, physical therapy, and physician assistant students. And we're projected to grow by 20% over the next 3 years. What's really interesting is that we are co-located with U of A. However, being a satellite campus, we do not have a lot of the same resources or options for our students to access here. So we are really limited on what our students can and can't access. What I will say, a good thing about the pandemic is that really allowed our students to be able to access online or virtual things that we could not get before. But so there was a real need for our students to have additional support because they didn't have a wellness center that they could walk into or a counseling center. So that was where we started to think of what can we offer here for those students at a statewide campus. So the first step was to create this 90-minute workshop for students with the idea of, are students even aware or understand? More than likely they've understood stress, but do they really know what burnout is, what that looks like? So we thought a really good starting place is let's start to increase their awareness of what is this and what can it lead to. So we wanted to focus on the stress cycle and burnout. So what does that look like? We really wanted the students to look at their own level of burnout because we thought that was an important step, starting point of where are you at? And then importantly, how can you develop strategies and an action plan for stress or if you are at that burnout level? So that was the goal of this. We've offered it in 2 different ways. The first time is we had a little, I call it a road show, where we would go into each one of the classes. And so individually, we would go and talk with the occupational therapy students and then the physical therapy students and physician assistant. And then we thought, well, hey, we could really make this an interprofessional opportunity and bring all of the students together. So in total, we've had about 350 students participate in this 90-minute workshop. The first, it was the individual programs, and then recently, a few weeks ago, we brought about 180 students together or so, and we actually did this together. So you can kind of see the breakdown. So we did a pre-post, right? You always want to know where are we at before, where are we at afterwards. At the beginning, oh, that's okay. At the beginning, we had asked students to rate their level of stress on a scale of 1 to 10. 1, no stress at all, up to 10. And so on average, the students rated about a 6 of their level of stress. And then I'm not sure if you can see this here, but what are those primary contributors to your stress? The largest one we know, academic. And then we've got social here, physical health, mental health was close, another concern, and financial. That was another big area of concern. A few things that students had identified as other, there could be moving related to clinical rotations, family, there was a lot of family stuff that started to kind of percolate, trying to manage families, and friendships. So those were just some different areas that they were sharing of what contributed to their stress. So foundationally, we talked about what is burnout, what is stress. We gave a lot of statistics about, okay, different health professions. This is your health profession. This is your rate of burnout. So a lot of that understanding of this is what it is. But an important thing that we've all talked about is the interactive activities of how can you actually apply it and learn about it. So one of the first things that we did with them is we had them take the burnout assessment tool. It's 12 questions, and it was just a really nice way for them to look at where were they at in this point in time. We didn't ask them to share it, but we said, if you feel free, feel free to lean over to your peer and talk about, where you're at. Are there some areas that you notice are a little bit higher or a little bit lower? So that was one of the first steps. Then we went into actually doing some, giving them some evidence-based strategies that could be done through their everyday. And so Erin, an occupational therapy student, led them through just doing some desk yoga. These are some simple things that can be done. So they went through all of the different stretches and exercises, and then they were given a handout so that way they could hopefully continue that at home. We did boxed breathing, which we will all have an opportunity to do here in just a few minutes. And it takes less than a minute to be able to do this concept of boxed breathing, which is just a mindful way to do some deep breathing. And then what has been a really good thing from NAU is that they invested in an application for all students to have access to, which is called CHER. And so this is an app that they can download. There can be mental health services provided for them free. There's a lot of resources on this app, financial wellness, information about depression, anxiety, looking at exercises that could be options. So we actually had the students download the app if they were willing, and then find something that they found to be interesting. And then they talked with a peer about something that they had found that was interesting. I think what was really an important takeaway from this session is they actually had to create and then share a plan. So not only you identified where you were at with your burnout, then you learned some strategies, but okay, what's your action plan? So depending on where you were at with your stress or with your burnout, let's find some, maybe you're already doing something or you have done something, like you've done yoga in the past and maybe you're not doing that anymore. Okay, how can you start to create a plan for yourself and then share it with your peer? So that was one of the takeaways. So, all right, so if you are all willing to do this with me, we're gonna go through just some box breathing. I was thinking that this would just be a nice way for you all. Has anybody heard about box breathing before? No? Okay, some people. So I will invite you to get comfortable in your seat. You can feel free to look up here on the screen, or if you want to close your eyes and go through this, you can go ahead and just imagine a box when you close your eyes. So just quickly, what we're going to do is you're going to breathe in, you're going to hold it for 4 seconds, or you're going to breathe in for 4 seconds, hold, and then breathe out for 4 seconds and hold. And we're going to go through that cycle 4 times. Okay. So everybody get into a comfortable position, whatever that looks like. If you want to put your feet flat on the floor, you can feel free to close your eyes if you would like, or keep them open, whatever you're comfortable with. And just go ahead and take it, just a deep breath, just a few deep breaths to get into a state of relaxation. I'm going to guide you through this process. And we're going to go ahead and breathe in, 2, 3, 4, hold, 2, 3, 4. Breathe out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4. Breathe out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4. Breathe out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4. Breathe out, 2, 3, 4, hold, 2, 3, 4. And with that, I'll go ahead and invite your attention back to the room. Hopefully you have found your body and mind to maybe a little bit more at ease or at peace. But that is just a fantastic way, especially with students, where we talk about right before those exams or right before a stressful situation, that is a moment that you can take. It takes less than 1 minute for you to be able to do in the moment. A lot of times people don't even know that you're doing it. So it's just a great way to just take a minute for yourself. So pre-post survey. So when we look at the pre, students kind of understood the stress cycle. They knew what burnout was. But more down here, like my level of burnout and having an action plans for feeling when I'm stressed, that was a little bit more somewhat unconfident, neither confident or unconfident. And so after the actual session that we did, obviously you can see we had extremely confident in the red and somewhat confident in the purple. And I think for me as a clinician, also as an educator, I was really excited to see that they felt confident that they had an action plan when they were feeling stressed and overwhelmed. And that was really one of the biggest takeaways that we wanted from this workshop, because obviously we want students to be able to incorporate those things that we have talked about. So. And then also just making sure, did they find this to be valuable? Sometimes you wonder, is this a good thing? Is it not a good thing? And so they found that this workshop was really a valuable learning experience, with somewhat agree and strongly agree. So anything that has kind of a thumbs up, whatever that may look like, I take it as a win. And then of course you have some where it's like, meh, not so much, and that's okay. So anyways, pretty excited that students found it to be valuable. So just overall takeaways, I think students positively received this and that it was important. Based off of the first time that we did it, the feedback that we've received is this needs to be done earlier on. And so the second time we offered it was for the first year starting their second semester. So really trying to begin that from the start with our students. And then now it's, okay, what's next? We did this, we don't want it to be a one and done. So now what can we do to help continue that conversation, get rid of the stupid stuff, and also create that culture for them, which I think hopefully you'll hear from Erin here in a little bit about what we're doing. So anyways, thank you.
My name is Griselda Escalon. I'm a family nurse practitioner at a community health center in South Texas, Su Clinica. I'm a DNP student at Ohio State. I should be graduating in May. And I'm very excited to be here. Thank you for inviting me. Um, I chose this project for my DNP program, and I was asked, what can make a difference? And I could have used something in pediatrics because that's where I work, but I chose to make a difference in healthcare burnout. At that time, we lost a lot of physicians and other healthcare providers because they were just burned out. And I did start seeing it after 2020. So let me get started. Is it this one? And if not, I can click it. Yeah, we can click it. There we go. Yes. So I was actually born at this clinic back in 1987. I am from Los Fresnos, and I got my BSN at University of Texas at El Paso. And then I went to Texas Tech University. I've been at Clinica since 2015, since I graduated as a nurse practitioner, and I actually did my clinical rotation there too. Now I'm at Ohio State, working on my doctorate in nursing practice. This is the clinical site where I work at. Clinica was built back in the 1970s for family, farm working families. But this is a fairly new building. This is about 15 years old. And we do have 4 locations, and they're all in rural areas, serving the underserved, the people without insurance, and the demand is just increasing because we are a border town to Mexico, and now we're seeing people, the refugees crossing over, and they're all over from all over the country, not just people coming from Mexico. So that adds to our demand. This is me when I was born at Clinica with a family nurse practitioner. My CEO actually recognized this picture because those were her nurses. And that's my CEO was actually working at that time. And this is where it all started. My family is a family of farm working families. And this is me back in the day, how it must have been like 15, 16 years old, just like 2 years ago. And this is my family working in Ohio, in the fields. So my dad, my brother, and I went to visit. Those are my girls, the little ones, and my aunts and my uncles, and that's my mom on the side. So this was the community health center at the working site. Most of the migrant families do not get health care unless it's there. So they would leave their working hours and then go back to work. So what is healthcare burnout? It is the state of physical, mental, and emotional exhaustion and feeling of overwhelm, fatigue, decreased motivation, and cynicism. Some symptoms are difficulty concentrating, reduced job satisfaction, and detachment. I had to be very careful when presenting this chart to my CEO and my administrators because it has a lot of things that contributed to the burnout, things that we were not doing or we could have improved. So I was very particular in the word choices, and I had to tell them doesn't mean that we're doing something wrong, but these are just simple areas that we can improve. And like Dr. Malnett said, we don't have a chief wellness officer. This was the first attempt to bringing awareness to healthcare burnout and what it meant to us and as an organization. So with that in mind, I used evidence-based practice and also what the staff was saying, the staff as in the providers were saying that led to their burnout. And some of them were stupid things like EMR. We were spending way too much time documenting, and that time was going into our family time, documenting at home. And if you think about it, nobody's gonna pay you enough to take time away from your family. So then we started questioning. The ironic part about this is that I went through it while being a student, getting my program and getting through the program and getting through my studies. I hit a point where I was like, I don't know if I want to do this anymore. If I want to be a nurse anymore, because one, I felt like I was lacking in every area as a parent, as a student, and as a clinician. And I had a complete mind mentality change when I'm like, no, thanks to my career, I'm able to make a difference. I actually went through something very hard which was a divorce. And thanks to my career, I'm able to provide for my daughters. So it kept me going. I'm like, so how can I make a difference now to others that are feeling the same way? So what I used was the 10 dimensions of wellness, which is from Dr. Melnick at Ohio State, and it made a huge difference. I presented it to the leadership at Clinica, and then I went on to present it to the clinicians. We pretty much did something very similar to this presentation. And then we did a single item questionnaire. I think by that point, we were all tired of doing questionnaires and not seeing a difference. So that was actually a really great idea. And I mentioned the costs, and so did Dr. Melnick, what it costs to lose a primary care provider, whether it be a physician, a nurse practitioner, or a PA. And I had to really focus on this one also when I presented it to my administrators, because at that time they weren't addressing the turnover. And it has not only monetary effects, but also the morale. So some of the feedback that I got once I finished my 10 dimensions, which was done in every week, we attacked one dimension per week, were these quotes from the clinicians. One of them that I really liked was, I interviewed a physician, and it goes back to the New York physicians that committed suicide. She was actually part of that cohort. It was 3 residents that were in New York, and she was part of it. She's a physician, internal medicine. And she's like, you don't know what the difference that this makes. It is so important to address, and we should have it more often, at least once a month, a meeting for all the providers. And she actually I printed out the 10 dimensions, made little pamphlets, and she has it on top of her desk as a reminder. And she said, it takes one person, which is right there at the top, to work on the environment and to keep this positive environment. And this was the questionnaire that we did. And of course, it was a scale. How in a scale, how do you feel your burnout? Occasionally I'm burned out, definitely burned out, or your symptoms of burnout are consistently. We do have a behavioral wellness, we have a nutrition, we have different resources there at work. So I just felt like this is a great opportunity to put everything together and utilize it. And this is the formula that we use for our results, the pre-data and the post-data. So speaking of more return of investments, like Dr. Melnick mentioned, this is a return of investment for every $1 we get 4 in return. Now, where I'm kind of struggling now as I continue with the studies and graduate, how can we keep this going and keep them engaged into investing in the chief wellness officer? Thankfully, their mindset has been changing little by little as they see the results and the engagement of the employees as well. So hopefully I can get them on board. And then there's also priceless outcomes, improving job satisfaction, reduced burnout and turnover, and improve patient outcomes. So these are part of the goals: continue to provide high quality, cost effective, and healthcare to our community, improve the continuity of patient care and burnout, and to build that culture and the resilience. And I'm closing with this picture. This is an actual picture from the people working in Ohio in the fields. This is actually right in front of my mom's house. I was going to orientation last summer, or 2 summers ago. And I walked out and I saw this people working, and I'm like, I have to run back and get my phone. This must have been like barely 8 in the morning. And it just shows that the strength to what goes on produces character, character produces hope, and hope will never let us down. And that's my presentation. Thank you. Uh, So there's 10 dimensions. One of them, like the most important one was social well-being, and that's pretty much interacting. I've seen the importance of that one, and I actually preferred email visiting the providers versus sending emails, because again, showing that they matter and they're important to this organization. And the other one was I can't think of it right now, but the spiritual, physical activity. And those were all part of putting it together and making the difference between, burnout and getting better. And honestly, when I was going through this project, I went through the 10 dimensions again myself. It's just as a reminder of like, keep going, of keeping that resiliency.
I have it. Yes, I'm going to share my screen. Thank you so much, everybody, for inviting me and for having me today. And I'm so sad that I can't be there in person today, but I'm here online, so that's great too. So I am talking today just a little bit about the College of Nursing at Ohio State University. So I've been so fortunate to work with Dr. Melnick really since she started, many years ago. And so I've been also getting have been very passionate about wellness and helping our students because there is such demand. And it's just so important that these things start, when our students are in school. So I just want to acknowledge, so Dr. Melnick appointed me the director of undergraduate wellness academic programming. And I often do this talk with my counterpart, Alice Teal, who's the director of graduate wellness academic programming. And then, of course, I wanted to recognize Dr. Melnick as well. So I'm not going to go into this in great detail. I think, this is why we're all here. But when we specifically look at students, what we're seeing is just these high rates of burnout really across the board, no matter what health science profession you're looking at, you're seeing it. So these are really, on the low end, about 50% of our students are coming in already, burned out. They're getting this burnout in their programs. And it's just so unfortunate when you think about they're not even in practice yet. So that is very, disheartening. And these are a lot of the factors that are contributing to this. And again, I know we've kind of gone through these already, so I'm going to just skip ahead a little bit. But, we all know this too. Our health science students have a higher risk of suicide, depression, anxiety, really compared to the general population. And we know that when our students are going in seeking treatment, over 40% of them are already experiencing a serious mental health crisis, which again is really, really concerning when we think about this. And again, this is just our health sciences students are more likely to be experiencing these things. They're having, increased clinical hours, increased work hours. They're seeing and experiencing that moral distress, that we often encounter in practice. And so how do we start to shift this paradigm and give our students the tools that they need to really transition to practice and then be in practice, for the long haul? Well, really, I will say, and I think we're all speaking, the same language here, is that we really need to shift this paradigm and we need to start giving them these tools while they are currently in our programs. And oftentimes when we're doing this and we're talking to faculty about this, they're always like, well, how can we add one more thing? And I think what we need to do is really shift how we're thinking to saying, if we're not putting this in the foundation of all of our curricula and all of our programming, then nothing else is going to matter that much. So this is really like the base of all other things that we're teaching our students, is how to keep themselves well during, this time of their life, and then when they go into career. So at the College of Nursing, we do have a philosophy that's called Live Well, and that stands for what you can see above: lead, innovate, vision, execute, wellness-focused, evidence-based, lifelong learners, and lights of the world. And as part of this philosophy, we designed what's called a Live Well classroom. And it's really focused on partnering with students and, just incorporating some very basic things to make a well classroom. So doing things like standing and moving more, encouraging healthy lifestyle habits, providing opportunities for student self-care and stress management actually within the course, and then really partnering and encouraging each other, promoting that self-talk, teamwork, optimism, and working hard, to partner and accomplish great things. And I love to put this slide up too, because I think in, when I was going through, and, years before me even, there was so much of this mentality of like the professor or the teacher had, the say, and they were, very strict and disciplined and held students to somewhat of unattainable standards. And they didn't have a lot of willingness to be flexible and to budge. And I'm not by any means saying that we don't continue to have these high standards, but I think, how do you want to be viewed as a professor, as a teacher, as, this woman on the left? Or do you want to be the person that's saying, I will partner with you. If you are having a hard time, I'm going to help you, and I'm going to, obviously push you to your highest, but I'm going to be there along with you so we can do it together. And so just to kind of throw that out there as, those of you that teach or are faculty, who do you want to be? And I think this goes along with it as well. Like, my teacher thought I was smarter than I was, so I was. So, if we are going in with the expectation that this is a trouble student or this student has caused me trouble, well, why don't we take the extra steps to find out why? And in doing so, partnering with them to help them be successful and maybe overcome those barriers that normally they would have a roadblock and be out of the program from. So it's just something to think about, because again, we know our students are struggling. A lot of times we hold the power chips, but we can use that power for good. So this is something, and I'll talk through some of these strategies, but this is something we do, and you can incorporate both into in-person as well as online, asynchronous or synchronous classrooms. It's this concept of lecture size. So you just lecture and then you kind of incorporate exercise throughout. And I have many versions of this that I do, but this is just 2 different ones that I'll have slides, and then I'll put up, this scene of this beach, and I'll say, okay, let's go for a run on the beach. And then, everybody kind of stands up and walks or runs if they have that ability to do so. Or, I'm from Buckeye Nation, right? So we like to dance in the shoe. So we'll put on Hey Sloopy and we'll all dance, as I put up this picture of the shoe. So it doesn't have to be long, it can be 30 seconds or a minute, but just to kind of get everybody up and moving. So then another version of something like this is, I'll invite students to stand up and walk through, pretty scenery, as we talk about, in this case, body habitus and nutrition. So I'll put up a lot of different pictures of, beautiful scenes, and we'll all walk throughout the course of that lecture. And again, there's a lot of different versions of this that, I've designed over the years. This is another thing that has been very successful to get and incorporate wellness into the classroom. And this has been replicated, throughout a lot of our programs at Ohio State. But this was something that I designed, a long time ago. But it's this extra credit activity that students can participate in. And it's totally optional for them to participate. And what it is, it's weekly wellness activities. And if they complete them, they get 0.2 points per week. And the way that I designed this, I made it small enough where it couldn't actually change a grade. But, the students don't necessarily know that, but they just see it as an incentive because they're getting this extra credit. And what I have them do is, at the beginning of the semester, they identify a wellness goal for themselves. And I say to them, I don't care what the wellness goal is. I don't care, if you do it every week, but I want you to tell me every week how you're doing with that goal. So every week they have to turn in that they completed the wellness activity that I had posted and how they're doing with their wellness goal. And I don't care again how they're doing, but it's a way to kind of refocus on that goal again for the student. So they have to put a very brief overview of what they did for the week and then how they're doing with their wellness goal. And I try to vary the content. So it'll be maybe 1 week, make a new healthy recipe, go for a walk with a family member or friend, do this short guided imagery or meditation. And again, really to kind of hit a lot of those different areas of wellness. And then as also a bonus, I try to pick activities where they can do things with family and friends. Another thing that I do is like just dance activities. So I'll put on a YouTube video and they'll have to do like 3 just dance videos. So meant to be very short, less than 10 minutes typically is what I go for. And when I looked at this within the courses, so I asked, did you achieve your wellness goal? And you can see on the blue, this was the percent of students that actually achieved their wellness goal at the end. And then the orange is those who did not achieve it. And then the gray is those who said they were very close to achieving it, but they didn't really achieve it. So you can see, the majority of our students are actually completing their wellness goals. And I had a very, very high consistent participation. Only 4% in this particular course didn't participate in any wellness activities. And then in the second course, only 7% didn't participate. And then 95% said they would like to continue them. But the very interesting thing is that 51% said they would still participate even if extra credit was not offered. We also looked at this model in a cluster randomized intervention study. So we looked pre and post, and we looked at stress and anxiety and healthy lifestyle belief scores pre and then following it. And then we controlled for it with also a very short, less than 10 minutes, implicit biased activity. And what we found is those students that participated in the wellness activity actually had decreasing scores as far as anxiety from baseline to post-intervention, whereas the other group, our control group, had increasing anxiety scores. And we also saw that same trend with our stress scores. We also do something called Wellness Olympics, where everybody that comes to the college is onboarded with these Wellness Olympics. So we put clinical groups against clinical groups, and they track 4 wellness behaviors every day for usually a time span of about 9 or 10 weeks. And they have to put in minutes of exercise, minutes of sleep, intake of fruits and vegetables, and then minutes of stress reduction. And then we pick the top 3 groups, and they actually get gift cards. There are also a ton of teaching strategies that we have put into this toolkit that we've designed. So here's the website up there. If you guys are interested in going there, it actually goes through the 10 dimensions of wellness and has different activities that you can use to incorporate into your classes for each of the dimensions of wellness, as well as this article that we just published on some of these strategies as well. So that is all I have. And I'm happy, I think, as a panelist, any of us are happy to take questions. Thank you.
So I want to congratulate you for what you're doing. And Kate, I look at Kate has been one of the best mentees I have ever had. But we're partners in everything that we do. And Kate's a DNP, I'm a PhD. But together we do fabulous work. We really do. So glad to see you, Kate. And Oakley, what you're doing is fabulous, really, with your students. Griselda, you're doing cutting edge work in FQHCs. Again, primary care lags so far behind hospital healthcare system-based initiatives. So you're a pioneer in what you're doing, which is awesome. Oakley, as you talked, you did a beautiful job, and it's exciting to see what you're doing with your interprofessional students. I spoke to 160 university presidents recently at APLU, and my key message was, you cannot make wellness optional. Students are overwhelmed with their typical coursework. And even if you have beautiful evidence-based programming, if you say it's optional, they're probably not going to do it. And I said to those presidents, you got to find a way to integrate evidence-based programming throughout your curriculum. You got to start on entry into a health curriculum, and you got to build upon it all the way through. Because if you don't build upon it, people are going to think, oh, this is just one time, whatever. It's ironic, but a lot of those presidents said, Vern, you're kidding. You're saying we should integrate this like for course credit into the curriculum? And I said, yes, because if you don't, we're just going to continue to produce generations of clinicians that don't have the tools to decrease their own burnout and enhance well-being. All of us, we just got to keep banging the drum, seriously, making change step by step. But as a dean, I felt it was crucial to have two faculty with FTE time allocation, and it's their job to work with the other faculty to integrate wellness throughout the entire curriculum. And I think that has worked well. Although, Kate, you could probably use more than 0.25 FTE, right?
Yes, we're very busy. We're very happy to work with faculty on this.
This is maybe for all of you. You know, when you look at what clinicians are going to go through in order to get from student to practitioner, isn't there built into the process inherent stress as part of paying your dues? You know, that is looked at as something that is necessary in order to get there, that you have to pay your dues. You have to have the 20-hour work shifts, that, you know, you spend 16 hours in the emergency room, you know, going from patient to patient to patient. And all of this is thought that if you don't do it, then you're weak and you're not going to succeed. How do you combat that?
I have a point for that. I think it's the prolonged. That's the key. Yes, we can do that for a few months maybe until we start feeling the actual effects. From then on, we notice like, okay, it's time to take a break. I need to step back. And like Dr. Mount said, either a vacation or just simply being at home. That makes me feel wonderful. So I think it's the prolonged. How long can you take it?
Yeah, how long can you take it? And it's like, but when
And that's individualized.
if you don't teach them how to recognize when you've gotten to that point, you know, then it's looked at as a negative. You know, that you know you're weak. You're, you know, and you know, as far as performance goes and evaluation and things, you have your residents, you have, you know, this whole hierarchy looking at you, and if you can't do it, if you can't hack it,
there's the door.
That's the change
You
in
know,
culture.
That culture.
Absolutely, that's a cultural issue, especially with our more seasoned folks, because they were brought up that way, so they're gonna bring up the next generation. It's interesting you bring this out, because one of my wellness team members is working with one of our health sciences colleges more intently right now. The dean of the college just brought up this same issue. Like, we gotta teach our students how to be tough, or else they're never gonna survive. And if they don't learn this in their curriculum, they're not gonna succeed. But I think we need to bust that myth, because it really is a detrimental cultural issue, and it's gonna take time to change. But what's sad is people end up teaching often like they've been taught. So it's this dysfunctional cycle. And again, it's a paradigm shift. It's gonna take decades to totally get us out of, but it'll eventually happen. I'd rather see it happen much sooner than later, but leadership is so key. You've got to have your leaders walking the talk and providing the resources and support that their faculty need to do this and do it well. And a lot of people just aren't willing to provide the resources.
Can I also interject just one thing here? Because I think it's important too, from like the standpoint of faculty, that we are telling our students to advocate for yourself. Like, it is no longer this badge of honor that you can go an entire shift without going to the bathroom. Like, that should not be a badge of honor. And you need to advocate for yourself that when you have a break and a meal, you are going to sit down and you are going to have it. You are not going to work through it. And I think how we're trying to change that too is, I think the mentality used to be when we were teaching is like, okay, you guys, do you want to like power through and like get through this lecture? Do you want a break? Now we don't say that. Now we say we are taking a break and you deserve a break, every 45 minutes or so, right? So we're trying to start that again in that foundation of, education.
So both Dr. Melnick and Griseldi, you mentioned return on investment a couple of times in terms of dollars. So I think your example was for $1 invested, you're seeing $4 in return. I'm curious, in your experience, what's making up that $4? Is it simply reduced turnover, or is there more in those return dollars?
There's more. It's healthcare claims. It's productivity, it's turnover. So there's multiple factors that go into that ROI calculation.
Yeah, thank you. I noticed also the engagement part versus what else do I need to do now? Or, hey, what else can I help with? That's the culture and environment that I'm seeing now.
Thank you.
But my point was from the previous points that we were having. So I would want to share, like, I'm a nurse manager in a 500-bed capacity hospital. So right now, what we're doing is that we as leaders, it's important that it's like what Dr. Kata told us before, not to wear overtime and overwork as a badge of honor. So for example, we're proactive to have mandatory lunch break uninterrupted for our team members. So whenever 12 p.m. and 1 p.m. hits, when I do my rounds, I always ask the team, did you had your lunch break yet? No, you need to have it right now. And then since I'm a 40-hour FTE, we don't do overtime, right? So let's say on a Monday, I was there 8 to 5 p.m. On a Tuesday, I will tell the team I'm leaving at 12 because I was here more than what is due. So if they're seeing me doing that, they would expect that in my performance evaluation, I'm not expecting them to do what I am not doing. So that balances it out. So it is important that because as leaders, there's no really handbook how to lead. Unlike when we were nurses, there are so many textbooks to follow. When we were nurses, we are focused with the things that we can follow. As leaders, there's a lot of books, but there's really no textbook to be a leader, if you come to think of it. So if we do that example, then our team members would tell themselves that, hey, Brian is not expecting me to do this because he is not doing it himself. And that is what Dr. Mer's been saying, a cultural paradigm shift that will take a while because we've been living for so long to have that badge of honor that, hey, we do overtime and all of this stuff. So that's my point with the previous one.
You are doing a fabulous job walking the talk. Again, leaders need to do that, faculty need to do that, because if we don't, our people won't follow. So congrats to you for walking that talk. I think that's fabulous.
I have a general question, and you might not have to, you don't have to answer this because there could be some people watching, but are you feeling like you're getting support from the higher ups? I mean, from Ohio State, it seems like obviously yes, but
Yeah.
I feel like this is.
I'm on my 5th president. So along the course of my journey, every time a new president started, I'd have to get in there quickly, show them the evidence, talk about how important this is. I've just been blessed to be convincing. But again, it's evidence plus emotion that really sells what we're trying to do. So never forget the emotional story that accompanies the hard ROI, because people relate to that.
You know, I agree with you, Dr. Burke, because as leaders, we have to be good storytellers. Because we show the graph and those numbers don't really mean anything to them because we're the ones who understand that. So, you know what they say, put some drama on it. Put it into work because that drama, actually, the 10% drama gets the buy-in. Because once you pinch their heart, you massively block their brain, and that's it. You get the thing that you would want.
Yeah.
I would say from NAU's side, definitely there is a shift and it is a slower shift, but I think from the college level, there is more support for that. And our strategic planning, strategic directions, we have a wellness and well-being pillar that we are focusing on, which I think is really important. And I think from our president down, there's been some cultural changes that have started to occur. But on my paper, I wrote, CWO at NAU, question mark. Okay, how do we, so, next steps, I think obviously can always do more, so.
Riz, what have you seen has been most helpful when you were doing your 10 weeks of activities and focus on wellness?
Actually, from when I started the whole project, this was the first time my CEO actually sat down and listened. She was very set in her ways to, this is how we do things, it's not broken, why fix it? And not noticing that we were struggling the whole time. So I've noticed that now she comes to me. Hey, what do you think we should do now? Here are some more ideas. We can use some help in this areas that, yes, it has to do with a clinician, but more system-based. Like, what are we spending too much time on or too much money on? And those are all little projects that will be coming along for a CWO.
That's great. Hey, can you think of anything else that you'd like to share? And we've got a question back here. Go ahead.
Yes, I wonder what outcomes you can talk about in terms of student retention or faculty retention, maybe scores or match rates or any of those kinds of metrics that leaders do care about?
I can speak as a student. When I started at Ohio State, I noticed their wellness right away and I knew I had made the right choice. I was very hesitant to come back to school, one, because I'm a full-time mom, full-time employee, and I was gonna be a full-time student. I'm like, how do I stretch myself that much? But I'm doing it. And thanks to the environment and the culture that is at Ohio State.
Yeah, I think to answer that question, we measure outcome every year. So we do the GAD-2 for anxiety, the PHQ-2 for depression. We do the one item burnout scale that's in the public domain.
Yeah.
We also integrate my published wellness culture scale in our annual assessment. So again, I can tell you, and we publish this data, our data for mental health outcomes during the pandemic and even after is so much better than national averages. But again, you've got to measure so you can show the impact that what you're doing is making. Without diligent outcomes assessment, you can't talk about impact. So I can show our president that impact that we're making.
I have a related question on surveys and assessments, because I think most organizations, it's annual and you don't want to overburden employees with just constant assessments. But how do you then identify during the year if something needs to be addressed quickly or changed instead of finding out just once a year? What are some of the tools that you use?
Ours is ongoing. So remember, we have 700 faculty staff, Buckeye Wellness Innovators in every nook and cranny of our colleges, of our medical center units. Those people are our force in the grassroots. So when something is coming up like that, they call us, they email us and say, Burn, we're under tremendous stress in our college or in our unit right now. So there's a constant interchange of communication. A lot of people have these ambassadors, but there's not a formal structure and program for them like we have at Ohio State. That makes a big difference. So if you're interested in learning more about that structure, we published a paper on that. We've got several papers published on a lot of what I talked about. But reach out to me at melnick.15@osu.edu if you want me to send you more things.
Thank you so much.
So do we want to do our quick little,
Yes.
fun little?
Yes. Yeah, if you can bring up, I do this all the time with students. When I do my keynotes, it's an easy thing. Anybody can do it. They laugh, they have fun. It's called CHER aerobic, right? So this is not a test of your coordination. This is to get moving and get some energy going, because sitting is the biggest zapper of our energy. Okay, Nick, you can play. Oh, you're playing CHER aerobics. It's the last slide on my presentation.
Play the music, DJ.
You'll know, yes, you'll know what era I come from by the song choice that I picked. These exercise bands, 3 days a week, you should do resistance training. Put this by your TV, put it next to your office desk. I travel with one of these all the time. They're as good as weights. You can Google resistance band exercises, but you can work every muscle in your body. Biceps with this, triceps with this, lower leg, upper leg. There are wonderful exercises, but visible, put it where you can see it. If you like to watch the news, which can be very depressing anymore, but put one of these by your TV. So instead of sitting and watching a show or the news, you can actually get your resistance exercises in. These are fabulous. Okay, Nick, keep going. then Kate's going to join us again, and then we'll be open for questions. So this focus is more on individual and kind of personal wellness. So go ahead, Erin.
Okay. Hi, everyone. I'm Erin. I'm a third-year occupational therapy student here at the Phoenix campus. Oh, thank you. And so today I'm going to be talking to you about my journey and what I've seen on campus, and as I'll end with my capstone and what I'm trying to implement as well on campus. So first of all, I don't want to take too much of this because we have been talking about it throughout, but I just wanted to continue talking and continue this conversation and addressing it because students' stress is very important, and it's definitely affecting, as you could tell, our mental health, our retention, our long-term health as well, and our academic performance. And then these are current data from spring 2023. So just updating what Dr. Rogers was talking about earlier. So now it's at 76.2% of students are reporting feeling more than average stress. And with that, student factors that are contributing to this, we already know it has to do with our finances and our debt. Like, are we working? Can we work? Do we need to work? Our academic responsibilities and our pressures that we have within ourselves, and then that we have with professors and our own like families, family pressures or issues. Do we have people to take care of? Do we have to take care of our kids, our parents, ourselves, as well as the factors of anxiety and burnout and the lack of social support? When we're stressed, are we reaching out to the people around us? Are we isolating ourselves? And then with the factors, it also, you see both sides. And I have definitely been on both sides of these, and I continue to be on this side, but I have seen students, they use the stress to be highly driven. They are hard workers and they're achieving their goals. But then as well as that, they're also having low self-esteem, and their academics begin to decline. And then they have this lack of motivation. So you definitely see both sides within a student. But going with that, the early signs of detection, which also goes hand in hand with what we've been learning with our physicians and our people working in the healthcare field. Just these are detections that you often see: anxiety, insomnia. I won't read them all, but those are all things that we've often have the conversations. And on this side, I pointed out like signs of student stress, and early detections end up being a ball effect of the signs of stress in students. So we are not sleeping enough, and we begin to be irritable, and our appetite changes. We either eat too much or not eat enough, and then our academic continues to decline. And so with that, I also wanted to tie it in with my experience. So coming into the program, I had a gap year, so I had to work I had to work and then enter the program, and it was definitely a whole life change that I had to reprogram myself into, like routine wise. And so with the signs, I did see that I was getting headaches, and I was not eating enough, and I was anxious most of the time, all the time, and I was not sleeping enough, and feeling very overwhelmed. And that's contributed all throughout my first year. And I wasn't asking for any help because I was seeing all my classmates, and they're also struggling too. So I was like, okay, we're all just having to go through it together. And so that's when I was seeing this whole effect of stress really affect me. And that's when I was seeing that I was not passing my exams, and I wasn't passing my quizzes, and I was self-doubting my questions, and I was feeling just very overwhelmed and not really sure what to do. So then with that, my professors and my mentors started to see that my academics were declining, and they reached out to me and were like, hey, how can we help you? And that's when I was like, okay, I don't have to do this by myself, and I can figure out a way. So the first year they were helping me, I met with Zach, our learning specialist, and he helped me with like how to write notes a different way, or different tools to study. And so then that was helpful to my first year. And then with that, I also scheduled therapy for the first time. And I was like, okay, this is not just anxiety and stress from like school, it's also anxiety and stress from at home and from working part-time and like all the other responsibilities that I had within my life. And I also, within the therapy, I also was able to identify that it was okay to request accommodations. And I requested testing accommodations, and I was able to get like a whole separate room so I could take tests and be like in my own space. And the minute that I got my test results from that, a whole different environment, I like was passing my exams and I was passing my quizzes, and I was like, wow, like if I would have done this at the very beginning of my first year, I would have seen such a bigger impact within my grades. But at the same time, like what I wouldn't be here where I am today if I didn't experience all of that. So I definitely now I advocate for students. Like if you are struggling from the very beginning, like it's okay to ask for help, and it's okay to like grab your core members and tell them like, let's do this together. So this also pushed this like wellness journey from within, because now I'm in my third year and I'm in my capstone portion of it, and I get to do basically my own research of what I wanted to do. And it definitely, all of that contributed to what I'm doing now, and what I will continue on as a future clinician. So I'm definitely continuing therapy. I am still doing the accommodations. Just being more mindful about what I'm doing and what I'm eating and how much I'm sleeping. And going into the end of my program, I do feel a little less stressed out because I can see the end of the tunnel now. And I don't have so much academic demands of like, I have all of these classes that I need to complete and all these exams to study for, but I'm having my own project that I really am passionate about. And so I have definitely implemented more meditation and working out and yoga, which are very new to me. And research is backed up with all of these that it really helps with your stress. So those are just a few things of my wellness journey as of right now. But as my capstone, so these are different components of what I'm doing from January to April. I created a 10-week wellness program on campus, and I'm creating a food pantry, as well as educating throughout various outlets, and I'm creating a graduate student appreciation week. So with the first component, I'm barely on week 4 now of the wellness program, and it's Mondays, Wednesdays, and Fridays in person and on Zoom. And each week we talk about different areas of wellness, of what Griselda was talking about earlier. I was like, oh my gosh, we're doing the same thing, which I love. And so with the main topic of the week, I'm also implementing Mondays will be yoga, Wednesdays will be meditation, and Fridays will be deep breathing and some sort of stretches during their lunchtime. And with this, the students that have participated have loved it, but I'm not getting enough students. Like I thought I was gonna have a whole bunch of students really interested in this, and I'm just not seeing that. They know the need, but they're not willing, to like step in. And that's where I'm at right now with the program of how to encourage them to participate. As well as I'm creating this Louise Quick Grab and Go. A previous student from my cohort started a pantry on our campus, and now I'm just opening it up to all programs within the campus. We're gonna be collecting snacks that are non-perishable, and this is just like a snack that they can have when they're on campus longer than expected or when they forget their lunch so that they can have access to. And it just also helps with food insecurities and being able to provide for them and feeling supported, as well as like the education and outlets. I am creating Wellness Wednesdays on social media. I'm sending out emails. I'm doing flyers. I'm creating TikToks, which I talked to Dr. Rogers about. Like, I'm in like my social influencer era right now because it's so new to me, but I'm trying to get where all the students are. I'm creating the reels, and finances was one of the big factors. So we're creating a lunch and learn with someone as a guest speaker talking about how to budget, what are actionable plans that you can take when you're graduating to, take out your debt that you have. And then I'm also creating a graduate student appreciation week tentatively at the beginning of April. And each day will be dedicated to like some sort of gift that they're gonna get. So they'll get like coffee and donuts on Monday and then like a plant on Tuesday. And so those are things that I'm creating throughout that week, just so that they feel supported, valued, respected, acknowledged, because all of our, like Dr. Rogers was saying, all of our support sometimes is up in Flagstaff. So I'm trying to connect with NAU Health promotions to our campus here so that all of our students here feel supported and that they have a place that they can go to here on our campus. And that is our class right there. So thank you so much for listening to my conversation.
So Kate, I'm going to cue you up again. Kate's going to join us again to share some
Yes.
additional information.
Okay. So hello, everybody again. Can you hear me okay?
Yes.
So I also, in starting this talk, wanted to give additional acknowledgement to Dr. Melnick because we did do this work together. So just to give a little bit of background, and so I know in this part of this session, we're looking at specific populations. And so just to kind of put the overall definition out there of what it looks like is really this idea of parenting stress and exhaustion that severely and chronically overwhelms a parent's resources and ability to cope with stress. And oftentimes what we see with that, it comes along with emotional detachment from their children. If you ask them like about their experience being a parent or how they feel about being a parent, they'll be like, well, I used to be a really good parent, but I've just kind of lost that ability right now. And then just feeling very tired with being a parent. And in May of 22, we put out this report specifically looking at working parent burnout. And we kind of, when you think about this, I think even though we looked specifically at the working parent population, a lot of this would probably translate to our student population who are parents, even though we didn't specifically look at that population. And what we found was really kind of sad and disheartening, but this report got a lot of press. And I think really in looking at this, it's because I know my experience with feeling burned out is that no one ever, I would think to myself, I don't feel depressed. I don't feel anxious. Like, what is that feeling? And when somebody said burned out to me one time, I'm like, that's it. You know, I feel burned out in my parenting role. And so putting a name to that, I think really resonated with so many parents because they're like, that's what it is. And you have to remember that this data was really collected in 21. So this was when we were kind of like through like the lockdown part of the pandemic. And this was that kind of residual overflow of, you know, we're having to homeschool our kids still, and there's this loss of control. And really, you know, this is kind of what led our journey into this subject. But just a little bit of background is, so I have 4 children. When the pandemic first started, they were, you know, 10 months, 3 first grade, no, kindergarten and second grade. And so I felt like I was really in the midst of trying to keep my job and trying to be a teacher and trying to be a wife and a house cleaner and a cook and all of these things. And I just kept thinking, I can't do this when you're in it and you're, having the daily with your children and the battles and the tantrums and, all the different things going on, is that it just tends to look a little bit different. But I'm going to talk just a little bit about what our study uncovered. So 66% of parents reported being burned out from their parenting role. And when you think about that number, that is enormous. We looked specifically at some of the demographics and characteristics of the parents. So women specifically were much more burned out than the male counterparts, so 68% to 42%. We found burnout was highly associated too if the parent reported anxiety. So those parents that reported anxiety, burnout was 78% in those individuals. It was also highly correlated with parents reporting their child had either anxiety or ADHD. So you can see those numbers also are in those 70s. And then parental burnout. And this was actually a very interesting finding, that when there was a concern by the parent that there was an undiagnosed mental health condition in their child, then their burnout was actually, that was one of our strongest indicators of burnout. Another thing that we found with the report and the study was that parental burnout was strongly associated with depression, anxiety, and then increased alcohol consumption in the parent. And then we looked specifically at how burnout related to some of these more punitive parenting practices. So we knew that burnout was associated with dramatic increases in the likelihood that a parent would insult, criticize, scream, curse, or physically harm their child. The other thing we found was we looked at the behaviors of the child. So specifically, we used the pediatric symptom checklist, and we found that so that scale specifically looks at internalizing behaviors, externalizing behaviors, and attention behaviors. So those internalizing behaviors are, feelings of being sad or unhappy, or they worry a lot. Externalizing behaviors are those that are more of the, they don't listen to rules, they fight with other kids, they tease. And then the attention behaviors that are, the trouble concentrating, they're easily distracted. And all of these things were reported to be higher in those individuals that had burnout. So what we thought and what we did is we made this 10-item working burnout scale. And really the thought was, this is something that people are not talking about. Specifically in working parents, things are a little bit different with, how work influences these things and how they can compound. And so we felt it was really important that people be able to identify and that practitioners be able to screen for this. So we put this together, again, 10 items. And there are things like you can see, I feel, or I get easily irritated with my children. I feel like I'm in survival mode. I have guilt about being a working parent, which affects my ability to parent my children. And then what we saw is, so scores being, if it was 31 or higher, that would indicate severe burnout, 21 to 30, moderate burnout, 11 to 20, mild burnout, and then 0 to 10, few or mild symptoms, or no or few symptoms of burnout. We also, as a very quick screening tool, we just did this one item. And so this is overall based on your definition of burnout. How would you rate your level of burnout regarding being a working parent? And so everyone, if you're a parent, you can take a minute to kind of look through this. But any score of 2 or higher indicates that you might be experiencing working parent. And so again, part of this burnout issue is really that it's not as well known as something like depression or anxiety. And really, we know that we need to be screening more parents for this. We need to be identifying this more, and then we need to be providing help and resources. And similar to many other things, we know that early intervention is really important when you think about outcomes, not only for the parent and the family unit, but also the child. And very similar with, depression, anxiety, like anytime these types of burnout symptoms start interfering with that daily functioning, or they continue chronically, they don't just kind of come and go, then, this is really our red flag that intervention is needed. And I know that I have only a short amount of time to kind of talk through this, so I'm putting in the highlights, but this is a whole conversation in itself. But really, we have to work with parents to understand the balance of their stressors and resources. So if we can decrease those stressors and increase those resources, we can actually decrease burnout. So a good example of this would be, if you're at that stage in your parenting where you're just feeling like you're driving your kids all over, to certain activities, and you feel like you're only in the car, that's a significant stressor for you. So to decrease that stress, you could enlist in a carpool. So you're only going once a week, one direction, or you could decrease the number of activities that your children are doing. So that is helping to increase those resources, which hopefully will decrease the stress and then decrease the burnout. But this is going to be very individualized, and every parent is going to be very different with how you can kind of help them to look at these things and then maintain that balance a little bit better. And then always building the strong foundation, helping parents to really talk about, there's this whole spectrum, right, between being selfish on one end, being selfless on the other end. And really what you want to teach them is you need to be in that middle space of self-care, right? If you're too selfish or if you're too selfless, you're going to get very burned out. So you have to practice good self-care if you want to be able to care for your children. So prioritizing the sleep, the exercise, the healthy diet, most of the time those things are in your control. We know from actually new research that we just did that the more that parents play with their children, actually that is very protective as far as burnout. So parents that play with their children more have lower levels of burnout. Learning those stress reduction activities, and then obviously looking and paying attention to substance use. Providing opportunities for connection. So, play groups, classes, maybe with their children, or little art or music classes, going to playgrounds and meeting other parents, and then parent support groups. And then teaching parents about this cognitive behavioral triangle of, feelings and thoughts and behaviors are all interrelated. And even, incorporating some of these cognitive behavioral therapies like reframing your thoughts. So helping parents to kind of work through some of these things can be very powerful. So example, my house is always messy. Well, you can also look at it as like, oh, my children are creating, right? Or my child is never going to stop crying. Or just reframing it, my child has to stop at some point. And even something as simple as I have to put my child to bed, reframing that to say, I get to. Not all parents get to do that. I get to put my child to bed. And then, they'll never learn to put their shoes on or by the door. And just always remembering that children, just like adults, need multiple reminders. Just ask my husband. I need many reminders. And then the last thing just always to touch on is how those organizational and systems considerations are really important. So having flexibility at work, that ability to work from home if needed, or offering online options, emergency care options, which, actually now at Ohio State, we do have those options available. Leadership support is huge. If I wouldn't have had, Dr. Melnick and other support and leadership, I feel like I never would have been able to accomplish the things that I have, just simply because, of having 4 children, but they were always so supportive of that. Policies that support parents. So gradual entry into back into practice, back into school, whatever it is after having a child, providing those daycare options that are on site, breastfeeding spaces, offering parent courses and support, and then obviously having mental health care available for parents as needed. And that is it from me.
I can now? Okay, do I need the mic? So I have a question for both Aaron, okay, Aaron and Griselda. So what helped you as a student, you know, as you're going through kind of the challenges of our wonderful education system, what helped you the most? And I know you put together a wonderful wellness program. Grizz, you had done a very similar program at your organization, but what's helped you to cope with education at school?
I think this is a perfect opportunity to bring you up. Actually, if I wouldn't have had Dr. Cindy Beckett, I would have quit because it's the support, the understanding behind it, balancing everything, and not only the demands with parenting, being a full-time student and full-time employee. So that made a huge difference for me, and having that culture of wellness and understanding at OSU.
Thank you. Aaron. And then Kate, I'm going to ask you a question too here.
I think for me, as of right now, as I'm going through it and ending my program, I had to allow myself that it's okay that school is not my 24-hour commitment. I had to really take a step back and be like, okay, I can't sit for hours and studying. This is just not healthy for me. And that was really hard for me to accept, to really just acknowledge that it's okay that to have a balance between everything, that I can go spend some time with family and friends. And all of my mentors have really taught me that, and that seeing them do it as well, I'm like, okay, I can do it too. So that's really what has helped me right now.
Kate, I know that you're in both the faculty and the parent role. What do you think would be the things that you would recognize were most helpful for you, both as a faculty and as a parent?
That's a great question. So one, I do have to say, you know, having support from leadership has been amazing. And not to say that, you know, that dads don't take on a lot of things, but moms really do take on not only a lot of the childcare responsibilities, but a lot of the emotional toll of the children as well. And so having that support, I think, you know, from the work environment was huge for me. I also think that having connections with other parents, because it makes you think, oh, I'm not alone in this, was also really important. Like there was somebody at the college where I swear it was for months, every night at like midnight, for some reason that we'd have like an email exchange of being like, oh, you're working too, you know, like, but it was nice knowing there was somebody up working with me, you know, that it was another person that was struggling with balancing everything and having, you know, their children at home and they're trying to maintain their job and everything like that. So, you know, having those parent interactions where we were all kind of in it together, I also think was really important. Yeah.
Thank you so much. Are there any questions or comments online or any questions in this group? Steve, did you have a question or just?
You, unless there's any online? I'm thinking more, you know, it's great between Aaron, you brought out some great program things. I'm wondering, are there examples of, because when we're talking about whether it's healthcare providers in training, you know, and then the actual healthcare facilities and organizations, we may offer things at a university that are completely disconnected from the real world of our healthcare, our clinics and our facilities. I'm wondering, are there efforts out there, and maybe this is to people in the online as well, where folks are coordinating what's happening at the university within the healthcare clinic so that, hey, students, as you're learning, here's what you have here. And when you get here, look for this because these places have that. I don't know if there's examples like that, but it seems like, I don't know.
I know that there's more and more published literature now since the pandemic around mental health and wellness. And so we're beginning to see more and more evidence out there about different programs. And I'm sorry, Dr. Melnick had to leave, but she has done an amazing job of integrating not just in our academics settings, but also in our medical centers, and working, very, very closely with both, so that as we have our students graduate and they go into the medical center, they're seeing that consistent message. So I think this is definitely an opportunity for all of us to rethink how we prepare our students for practice, but also partnering with our agencies that we're sending our students to on how we can support wellness in those areas too. So we need more chief wellness officers for sure. But I don't know if anybody else has any comments. Oakley.
To, they're not only interviewing you, but you need to interview the site and make sure it is a good fit. Like, for example, you can make a lot of money in home health as a new grad, but you are out there on your own and little mentorship and support and guidance. And like, is that really the best environment for you? So I think training students on what works for you and how, like, what kind of environment you're successful in, I think is a really important piece of that.
Go ahead, Steve.
That's a good point. I was gonna say on the flip side too, what about opportunities where the programming, the support systems we have for our students that are training to become a provider are learning from our healthcare systems and some of those agencies as well, so that there is a better match. I don't know if that's an opportunity or if it just seems like more partnership is always needed and so challenging.
Oh, absolutely. And I know, Kate, you and Alice there at OSU have really been helpful for faculty. So they've put together a faculty toolkit that is amazing. So if you're a faculty and you've been asked to integrate wellness into your course, they have a toolkit that you can follow the strategies in there or pick and choose and integrate them into class. So I think helping faculty to know what kind of strategies I think is key. Do you want to mention anything about that, Kate?
Yeah, that resource is available to anybody. You don't have to be at Ohio State to utilize that, but it does go through the different dimensions of wellness and how you can integrate those, as I talked about a little bit in my presentation. And then there is actually also another toolkit that AACN, the American Association of Colleges of Nursing, it's either already out or it's very, very close to being out. That also looks specifically at strategies that faculty can use. But we tried to really make the toolkit where it goes across settings. So like it's pertinent to the clinical setting, the asynchronous classroom, the synchronous classroom, and then the in-person classroom. So yeah.
Thank you. And we'll make sure, I know it's in Kate's presentation, but we'll make sure that that resource is available to all of you as well. And yeah, and that connects to the 10 dimensions of wellness. And Erin, even though your reference was a different program, they overlap. I mean, they're those key factors. And I know in using the toolkit and integrating in my own courses, each week it's a different activity. And some, it's optional. Some students do all of them. Some do, part of them. And I give student permission. If you look at the weekly activity and you want to do something different, tell me what you did. It just needs to be around wellness and interacting. And it's been amazing, the response from the students. And some of the quotes I've gotten are, it's so great to be given permission to go for a walk. And I'll tell my children, okay, my assignment this week is to go for a walk. Would you like to go with me? And getting their kids involved. And it's been a real positive. And it's great for faculty too, because I go through it every semester. Okay, this week is this focus. And it's a nice refresher for me. So any other comments or questions? Let's see, just no questions. I've learned a lot. Any comments from anybody? Anybody else?
Got
Steve?
another question.
Go ahead,
So I'm full of questions.
Go ahead, Steve.
Earlier Bernard mentioned provider denial, and that is a major issue. And that's where I was struck by Erin. You brought that up as well. It's like, hey, I know now I need to reach out for help, but where does that turn around? And is there enough, if students learn that when they're going through the program, hopefully they continue that, but they won't. I'm pretty sure providers, because no, I have to be the strong one, right? So I don't know, are there approaches that we know from the research or that systems are using to help folks realize that they need help or can reach out and ask for help?
Reducing that stigma.
Yeah.
I think that's a
It is
big
a
key
sti-
for
it is
the
a stigma.
cultural and the stigma, and knowing that it's okay to reach out for help.
I mean, I mean, unfortunately, I mean, the pandemic, the good things that have come out of the pandemic is an increased awareness that mental health affects everyone, no matter who you are. And so, I mean, I think that's a good thing, but I don't think there's a perfect way to say, yes, this is how you do it. I think having conversations, integrating it into clinics, and we just wrote an article, Griz's first article, which is awesome. We got to, Bern and I got to work with her. In primary care, there's very little evidence-based work being done and, you know, wellness work. So this is a huge opportunity and a model that we could take across all clinics. But I think it's getting everybody on the same page, increasing that wellness awareness, and then identifying strategies. And I know, Grizz, you had a pamphlet that outlined different things that they could do. They had a different focus and different activities. You had a similar model. There are models out there in publication. So I would say beginning to have those conversations with your partners to say, it's okay. If you're having a, you know, and asking that, are you okay today, is a wonderful phrase. Because you know, we always, you know, people say, hey, how are you? Oh, we're great. And you're not. But how are you today gets a different response. So just being open to having those conversations and then bringing up the fact that, hey, we can all improve. What can we do better to support each other so that we are better providers, we're better teachers, we're better mentors and support, because we all can learn from this. Any other comments?
I'd like to make a
Go
comment on
ahead.
that. It has to do with us, you just, taking personal responsibility for our own. When we realize that, okay, maybe I could use some help here. Say, where do I see myself, I don't know, a year from now, 5 years from now? Do I want to be that parent? Do I want to be that student, that clinician? Because again, what we are reflects on our kids as well. So I know when I went through it, I knew that if I was okay, my kids are gonna be okay. So that was my biggest motivator. Like, I have to be good for them. I want them to be okay. Very good.
And
Yeah.
I think we need to recognize our parent situation when they were pushed to become parents. I say push because that's really what it is. For example, I'm now 40, but my dad's only 57. My mom's 54. So they were kids raising a kid. So we also have to put that into consideration. So I guess what I'm thinking right now is that we have to embrace the fact that being vulnerable is a strength rather than a weakness. And all of us should be open about it. And that starts with mental health as well. And that will slowly break down all this stigma and all, because gone are the days that that you are strong and alpha and all, and that's so big. I think this time around, we have to shift our mentality, and it takes all of us. And in our situation right now, it should start from the leader. Use your position to be an influence. You are in a particular position and use that outside your organization. Like what I do right now. The hospital didn't send me here. I went here on my own volition. So use your position right now to be an influence outside your organization, and that will start making a difference. Right now, there's only how many of us here, but I'm hoping I could also influence the 41 people right there out in Zoom. You know? So it
Well,
starts small.
You're right, and I think Bern said earlier, you don't have to do all 10 of the wellness dimensions. Pick one and start focusing on that. And then when you get that hardwired, pick a second, or pick an activity that makes sense and make a little movement. That little movement will become another movement. So we always, in evidence-based practice world, we always talk about eating the 2,000-pound chocolate elephant, and she showed a carrot picture that was a little bunny and a giant bundle of carrots. That's the healthier version, but it's one bite at a time. You can't overcome, you know, we can't become well overnight, but one step at a time, one bite at a time. And just know that we all need to be moving on this journey, and we need to help our students. We need to help our peers. We need to help our community to be a more well community. So I think we've got, let's see, somebody just wrote a giant thing. Oops.
Make a comment.
Yes, go ahead, and then back here.
I thought of with your question, Steve, about how do we get people to be comfortable and disclose that, what I have seen in the nursing literature is mentorship and that one trusted peer professional that you could, that's one of the main things I've seen, but I haven't seen much more.
Thanks, Laura.
I think it's also important to not negate the beauty of getting an annual blood draw and finding out maybe there is an underlying physical problem. You know, if you're not remembering things at work, that's going to create more stress for you. Go to your doctor, get an annual blood check and see maybe there's something that is organic in you that you need to, address. Because you can do all the yoga classes you want, but if you have anemia and that's the reason for your fatigue, my gosh, that's an easy fix for the most part, unless there's obviously more to it. But I think we have to really remember that as well, because it can just snowball around and around and around. You're thinking, my gosh, I'm trying my best. But if there's an underlying organic issue, you need to address that. The other thing that I want to mention is 10 minutes of walking in the morning, first thing. We all have busy lives. When are you going to get your exercise in? We all struggle with that. Get up literally 15 minutes earlier. Don't brush your teeth before you go. You get your tennis shoes on, you go out, you walk for the 10 minutes, you got your 10 minutes in. Think simplistically in wellness, and it can go miles for you.
And there's some great resources on YouTube for activities in the house. So if you can't, if the weather's bad and you can't get out, how to walk in the house and get, activity in the house. So, I mean, there's lots of little things. I know we need to wrap up, but go ahead, Erin.
That's a great point, because even within my program, I'm like, students don't want something very long and they want something quick. So I've had to create things that are like a minute, 3 minutes, and that's been like reaching to them more because it's something they can do, like a quick break when they're going, when they're studying.
Well, and what Dr. Melnick said, sitting is the worst thing we could be doing. So standing meetings, standing classes. Well, thank you all. This has been an amazing day. I think we've got a few more comments that have come through for we're going to wrap up, but we'd love for you to do the QR code again, to do the post test, and then let us know if you would like to have CME or CEU, and we will send you a certificate. But we thank you so much for participating. I think it's a great topic. Please let us know if there's other things that you would like to hear in the future and workshops for next year. But we will make sure that we include resources along with the recording of this presentation. But we so appreciate all of you being here in person and online. I think it's a great topic. Anything else you want to say, Nick or Steve?
Wrap it up. Just want to share some information about our upcoming workshops. This is the first of 5 of this year's ABRC education series. We have one more coming up on April 4th. That one's going to be a dinner up in Flagstaff. That's substance use disorders, crisis management, and treatment resources. We have one on April 27th. That one's water scarcity, the health and the healthcare response to water scarcity and access. We have our 6th annual May Forum down in Yuma, which that one focuses on border health, and we're bringing in a ton of researchers from Mexican universities to kind of share their work and discuss kind of the success story that we've had down there working with them over the past 6 years. That one's going to be May 13th and 14th down in Yuma. And then our last one is June 8th, and that's Beyond BMI. Battling, what is I can't remember the finishing title of that, but it's Beyond BMI, tackling the stigma with body stigma, weight stigma. And so that one should be a really interesting, great conversation. And so we're getting a lot of attention on all these workshops, but I will send out, along with the link to this video and the resources from this workshop, a registration link to all the other workshops as well. But thank you all so much for attending. And I think we can wrap it up there. Thank you all.